Your attention so I can call this February 9th, 2021 Board of County Commissioners meeting to order. We'll start with agenda item 1, roll call to order 1A. Will the clerk please call the roll?
Here.
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 Present.
Here.
Very good. We do have a quorum with 7 county commissioners present. I'm going to now turn it over to Commissioner Greg Weiss for the invocation and Pledge of Allegiance. Will you please rise and join us in both?
Lord, help us to be sensitive to what is happening to those around us. Make us aware of the concerns of others and guide us through the decision process that is before us today. Give us the strength and courage to do what is best for all those who come before us. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Weiss. We'll move now to agenda item 2A, additions, deletions, and substitutions. Madam County Administrator, you're recognized.
Mayor, members of the board, we do not have add, delete, and substitution for today. However, I did get a request per the mayor to move item 6D1 to reorder and make that the first item on the regular agenda. Also, Commissioner McKinley requested that her off-site proclamation, she wants to read it into the record for the life of, honoring the life of Richard Maychak, who was a great contributor to our community. She wants to read that at the beginning of special presentations prior to Dr. Alonzo's presentation.
Very good. Commissioner McKinley, you're recognized.
Yes, thank you, Mayor. Representative Maychak's wife is currently in a nursing facility, so I can't present this to her, and I know that his family is assisting her in watching the meeting this morning, and we wanted to give them as much of a time certain as we could. So I appreciate consideration of reordering the agenda. So with those two changes to the order of the agenda, I'd move its adoption.
Second.
Thank you, Commissioner McKinley, who has moved the amended agenda forward, seconded by Vice Mayor Weinroth. There's no public comment or comments by members of the board. All in favor, all opposed. The agenda has been adopted as amended, and I thank the members of the board for allowing me to bring up 6D1 under regular agenda first to accommodate residents that live within District 3 that are here related to the Lantana Airport agenda item. And a reminder to members of the public that it is a mandatory requirement to wear a mask within this chamber. If there's an exemption or exception that pertains to you specifically as to why you can't wear a mask, then we've provided alternative accommodations, and the member of county staff can assist you. Further, if you'd like to make public comment on any agenda item, please submit a comment card before that agenda item starts to a member of the county staff. We'll move now to agenda item 3, consent agenda. Is there any member of the board that would like to pull an item from the consent agenda? Vice Mayor Weinroth, you're recognized.
Yes, Mr. Mayor, I'd like to pull item 3CC1.
3CC1 has been pulled from the consent agenda. Any other commissioner wish to pull any item from the consent agenda? Very good. Is there a motion to move forward the consent agenda except for 3CC1, who's been pulled by Vice Mayor Weinroth?
So moved.
Is there a second? Motion made by Vice Mayor Weinroth to move the consent agenda forward minus 3CC1, seconded by Commissioner Weiss. Is there any public comment cards, Commissioner Bernard?
No, Mr. Mayor.
Very good. No member of the board would like to make comment. All in favor? All opposed? The consent agenda passes 7-0. Vice Mayor Weinroth, you're recognized.
Thank you, Mr. Mayor. I need to notify the board that I have a conflict on item 3CC1. My spouse is an employee as executive director of the Boca West Community Charitable Foundation, which in this item is being proposed to receive $32,000 to be distributed by the Palm Beach County Sheriff's Department.
Very good. Vice Mayor Weinroth will be abstaining from voting on item 3CC1. Is there a motion to move that item forward? Motion by Commissioner Weiss and seconded by Commissioner Bernard on 3CC1. All in favor? All opposed? 3CC1 passes 6-0 with Vice Mayor Weinroth abstaining. We'll move now to special presentations found on page 31 of the agenda. And it's my honor and pleasure to welcome to the podium Dr. What's that? My apologies, Commissioner McKinley, and my apologies to the family members that are waiting to see this presentation, as we are as well. You're recognized.
Thank you, Mayor. This morning, we are going to honor the life of Richard Maychek. Many of you know him. Some of you actually served with him. Whereas Richard A. Maychek, 83 years old, a lifelong resident of Delray Beach, passed away on January 26, 2021. He was the son of Michael and Helen Maychek, and in 1958, he married his high school sweetheart Wanda and began a career in gladiolus farming with Maychek Farms and Mazzoni Farms. Whereas dedicating his time advocating for multiple issues surrounding the rural areas of his community, Mr. Maychek served on many agricultural, environmental, economic, and healthcare boards and committees. Whereas he served as a distinguished trustee of the South Florida Fair and was appointed to the South Florida Water Management District Governing Board. In 2000, Mr. Maychek was elected to the Florida House of Representatives for District 78, where he served 2 terms. In 2010, he was appointed USDA State Director for Rural Development for Florida and the U.S. Virgin Islands by President Obama and served in this position until his retirement in 2018. Mr. Maychek was known for many things, but he was most proud of being granddad. He loved fishing, trying his luck at the lottery, and visiting the family farm in the mountains of North Carolina. Those who knew Mr. Maychek well knew that his true happiness was found gathered around a table of food surrounded by family and friends. And whereas Mr. Maychek is survived by his beloved wife of 62 years, Wanda, his daughter Carol Maychek, and her spouse Michael, daughter Kim Unke and her spouse Brian, his sister Rose Sloan and her spouse Nick, and 4 nieces, 6 granddaughters, and 7 cherished great-grandchildren, as well as his dog Chloe. Mr. Maychek was preceded in death by his brother Ronald. And Representative Maychek was laid to rest at the Delray Beach Historical Memorial Gardens. Now therefore be it proclaimed by the Board of County Commissioners of Palm Beach County, Florida, assembled today, that the board hereby declares this proclamation honoring the life of Representative Richard Maychek. Thank you.
Thank you, Commissioner McKinley, for that very meaningful proclamation. Is there any other business under special presentations? Very good. We'll move now to agenda item 4B, which will be the special presentation on COVID-19. And I'd like to invite to the podium Dr. Alina Alonso. Ma'am? Oh, and Mary Blakeney, I'm sorry you weren't on the agenda, but we're excited to have our new Palm Beach County Emergency Manager, Mary Blakeney. Thank you. 61, thank you. 16. Okay, thank you. Good morning.
Always my pleasure to come and talk to you all. We're going to start with the regular presentation. Okay, just want to make sure I wasn't missing anything. As you can see, what I did, which I've been doing regularly, is just to give you a sense of where we are, where we were last week, and where we are. You can see last week we had an additional 1 million cases, and as our graph is going to show, those cases have been coming down, and Now we only have an additional 781,794. Our deaths remain about the same with an additional 21,000, but it's good to see this coming down. And you can see it here in this graph, where we had our highest spike back in the beginning of January with over close to 300,000, and now it's coming down. So now we're here almost at 100,000. We had not been at that rate since mid-October. So if we continue to follow that graph, and that graph continues to come down, it should be somewhere around here. So we probably have another 3 or 4 months until it comes down to where we can be safe. Now, the big issue that everybody's worried about, and the CDC continues to make sure that we are aware that with the new virulent strains, the mutated strains that are susceptible to the vaccine so far, but Florida has the highest number right now, and that makes perfect sense since we have so many people traveling from all over the country to Florida. So we need to be very careful. The last group that we tested, where 30 people came down positive with apparently one contact, we were almost certain that that was one of them, but it was not. So what that means to me is that people are letting their guard down, and they're forgetting to have their masks inside. They're forgetting to have their mask when they're with people that they haven't been around for a while. So we just have to be extra careful, because we do not want this virulent viruses to spread. That could be disastrous, and that could put us into another wave. So we're doing a great job right now making it come down. I think people are very happy about the vaccine, but they can't forget that this is not over, and we want to make sure we do everything to make this thing go all the way down. This curve has to come all the way down the same way that it comes down here, and it has to continue going down. Each time that we have gotten a little relaxed, thinking that it's going away, pops back up. Starts coming down, we get careless, goes back up. So let's do it right this time and make it actually all the way down. Here's our numbers for as of Monday, yesterday. We have 1.7, almost 1.8 million cases total in Florida, with 74,543 hospitalizations and 27,815 total deaths in the state of Florida. Palm Beach County is at 111,434. That's a new additional 413 cases. We're thrilled to see that number, and not the high numbers that we were seeing before. And we have 5,759 hospitalizations total, and 2,269 people have died in Palm Beach County due to COVID. That's 19 new deaths as of the day before. These are our stats. You get these every day from Ed. Thank you, Ed. You always come through on this. And I just want to show you the 3 main areas that we're most concerned about. Obviously, the cases per day, they're averaging 597. We've only had one over 1,000 on the end of January. And we've actually had some small ones, like 351 at January 31st. And as you can see, we had another one on Sunday of 376. So we're very happy to see those 300s, and so are our contact tracers. The other piece that's very important is our daily positivity rate. That remains an average for the 2 weeks of 7.79. That's higher than we want it to be, but we've had 1, 2, 3 days that it's been not below 5, but at least at 5. So I am hopeful that if we keep this up, again, we can bring this down and start seeing that 5% that we want to be at or below. What has not gone down in any shape or form is the total positivity of the total people tested. That continues to be very high, 15.71. And it's gone up every single time, as you can see, sometimes by as little as 1/100 of a point, but definitely the trend is up, not down. So that means we still have to work on stopping the transmission. We're still here at phase 1. However, I am very encouraged that at least, even though we're getting small amount, the small amount has been coming through as promised by the state, and we're very grateful for that. So just a little bit more push to be on phase 2, where we can start using more of our mass vaccination and do some of the things that the people are wanting us to do. Our vaccine, there's done several of these presentations and there's still confusion. I want everybody to note what's written on top of this line that says we do not count people twice. This is very similar to the way they count the total positivity. In other words, a person's only counted once. If they go from first dose to second dose, they simply move in the bucket, but they're only counted once. So we have done 134,970 first doses, and 55,800 individuals have gotten their second dose. So the total number vaccinated are these two buckets, 190,770. The number of total doses that we've administered is 246,570. So these are doses, total doses, which count for all the people that have been vaccinated and all the doses that have gone out. But the first dose and the second dose make up the total number vaccinated. So if this person here, the last person here, the 134,970, once that person gets a second dose, he moves out of this number and goes into this number. Okay? So keep that in mind, because that's thrown some people off. So the number of people that we have vaccinated over the age of 65 is taking these totals, these three totals right here, okay? And that is what we're looking at, our percentages, and that's how we're calculating these things. Also, the new census has some preliminary data already, or at least data for the 2020 census. And we had been using the 2019 census. So sometimes when we've calculated these things, they might be a little off. It all depends if you're using the whole number or right to the decimal point. So just keep in mind that these numbers can be a little different. But based on the 2019 data, which I've been using, Palm Beach County, with this 190,770 people who have been vaccinated, we're at 13% of our total population in Palm Beach County. Higher than Florida, higher than Broward, higher than Dade. And that's important because our populations are different. So to me, this is a great accomplishment here in Palm Beach County, and it testifies for the great work and the partnership that we have with the county. They have been doing an outstanding job in helping us. A lot of logistics. Mary, thank you very much as the new director of our emergency management division. And thank you, Ms. Baker, for all your assistance, and of course the entire board, starting with you, Mayor, who have been nothing but supportive of us. So really appreciate it for all the people of Palm Beach County. We need to keep doing what we've been asked to do. Wear our masks wherever we go. Make sure you wash your hands frequently. Use your sanitizers, but soap and water is still best. And watch your distance. With the new, more spreadable virus, I would watch your distance even greater than we have before. It's very important to stay away from people you don't know, and certainly if someone around you is not wearing a mask, stay far away from them. That's all I have. I'll wait for questions.
Very good. Thank you, Doctor, for uplifting report. We're going to table questions until our emergency manager has an opportunity to speak. So we'll recognize Ms. Blakeney. This is your first time officially before the board as our emergency manager, I believe.
Yes, it is.
Congratulations. And,
Thank you very
excited to
much,
work
Mayor.
with you.
Good morning, Mayor, Vice Mayor, Commissioners, Administrator Baker. Today is the 330th day of our EOC activation due to COVID-19, and I'm presenting the weekly update of the COVID-19 Phased Restart Program, and you can follow along with the CPR matrix that was provided to you earlier. Remember, these indicators are designed to demonstrate resurgence, not necessarily improvement. Recall that the red-colored indicator means the benchmark has not been met, and the green-colored indicator means the desired benchmark has been met. Whenever possible, we've tried to include charts that demonstrate the larger historical trends to help provide a broad perspective on the benchmark figures. As seen on the matrix, we did not meet 2 of the indicators this week, as was with last week's indicators. Our overall positivity rate continues to increase, currently at 15.67%. Overall, positivity is simply the quotient of the number of positive test cases divided by the denominator of total tests conducted. The red line on the lower left-hand graph indicates a 7-day running average, representing an overall increasing trend. The upper right graph shows the overall positivity rate has been steadily increasing since its low of 12.14 on October 25th, 2020. As seen in the upper right-hand graph, our daily lab positivity rate has been increasing steadily since mid-October. The lower left-hand graph shows that during the last 2 weeks, though, our daily lab positivity rate has averaged 7.18%, which is above, as Dr. Alonso said, our 5% target. The red line on this graph indicates a running 7-day average. We have seen a decreasing daily lab positivity rate for 2 consecutive weeks. As the chart on the lower left shows, over the last week, we saw fewer patients hospitalized with COVID-19. We are seeing a 7.6% of our total hospital beds countywide being used for COVID-19 patients. This time last week, it was 7.7%. Note that local hospitals are running at average occupancy rates of about 75% this week, basically in line with last week. The chart in the upper right shows the historical trend of COVID hospitalizations in Palm Beach County. In terms of mortality, the graph in the upper right corner shows that our COVID-19 related deaths continue to slowly decline. We have seen our death rate, that is the number of deaths divided by the total number of COVID-19 cases, decrease slowly since mid-July. Our death rate currently stands at 2%. In the last report, the 14-day average of deaths averaged 1.4 deaths per day. This is where we saw a little increase in our indicator. We're now averaging 1 death per day. Over the last week, we saw fewer COVID-19 patients in our intensive care units countywide. The graph on the lower left shows the week's trend. The small graph on the lower right was last week's trend. As you can see, the trend this week compared to last week has flattened a bit. On average, about 22% of all ICU beds countywide are currently occupied by COVID patients, and that was the same as last week. That is about 91 patients per day countywide. Recall that we were treating an average of 149 patients per day in our ICUs on July 20th, 2020. Our countywide ventilator utilization rate has remained stable, averaging around 48% of capacity for the past week. We continue to hold weekly calls with the hospitals. As you recall, the 911 calls for patients who are positively screened for COVID-like symptoms at the scene are designated as med alerts. Since Palm Beach County Fire Rescue transports more than 50% of all EMS calls in the county, this represents a countywide sample of people with COVID-like symptoms. We can see by the chart in the lower left corner that med alerts have on an average decreased this past week to about 14 patients per day. Recall that July's peak average was 24 a day, as shown in the chart in the upper right-hand corner. The maximum number of transports was 37 a day on July 20th, 2020. So, emergency department visits with COVID-like illnesses. We have seen that weekly counts of emergency department visits representing COVID-like illness also closely parallel COVID-19 infection rates in Palm Beach County. So we use this as another benchmark. In mid-July, emergency department visits with COVID-like illness peaked at 1,090 cases a week. In the week of January 9th, 2021, we saw emergency department visits with COVID-like illnesses peak at 876 cases in a week. This week, we're down to 541 cases for the week. Testing remains strong. We've tested over 732,000 individuals at our testing sites. We still have at least 120 testing sites, and Palm Beach County Fire Rescue continues to do homebound testing. And as Dr. Alonso said, we need to continue with our 3 Ws, wearing our mask, washing our hands, and washing our distance. The trends that we're seeing still is our overall positivity rate is continuing to climb, and the average death rate is over a 14-day period increased slightly. On a positive note, our daily lab positivity rates have decreased 4 weeks in a row. Our hospitalization and ICU rates are decreasing, and our med alerts have decreased. Another sign of hope is that we have vaccinated over 192,000 people in Palm Beach County. We have been number 2 in the state for shots in the arms and are close to being number 1, almost surpassing Miami-Dade. We have vaccinated over 156,000 seniors in our community. We continue at the EOC with twice daily multi-agency leadership calls. We continue to have daily calls with the state EOC, and we are unified in our mission of getting shots into arms. We have the infrastructure to achieve that mission today. This week alone, we anticipate between the public sites and the government-led vaccination sites, we'll be doing another 30,000 vaccines within Palm Beach County this week alone. I want to assure you that that emergency management and the EOC, we work very closely with Dr. Alonso and her entire team regarding vaccinations in our community. It continues to be a supply and demand issue, and as soon as we get more supply, we will get the shots in the arms. We are seeing signs of hope that we're seeing a little bit more vaccine and hope to see fewer cases of COVID. That concludes my report.
Very good. Thank you, ma'am. Are there any questions or comments from members of the board? Commissioner McKinley, you're recognized.
Thanks. Just a couple of questions. First, on these numbers, on the vaccine numbers, I read a report yesterday was giving Miami-Dade County a little bit of a hard time because their numbers, considering they accounted for about 20% of all of the positive cases in Florida, they were only at about 7% vaccination rate. So Dr. Alonso, we have been asking for data, number one, data by zip code. So my question, if we can figure out how many people have been vaccinated in our county, why haven't we yet been able to get that data by zip code?
Because I personally don't have access to it, or you would have had it from day one. So I have requested it several times. They said they're working on it. I have not been able to get it.
Okay, who would we make that request to?
I would make the request to the Department of Emergency Management at the state level and see if they can release that. Every county is looking for that.
Okay, and so our numbers, I'm curious. I don't like to see other counties get beat up in the media. So of the 13% that we have vaccinated, of the seniors we have vaccinated in Palm Beach County, are you telling me that all of those seniors were vaccinated at a Palm Beach County site, or have some of these gone to other locations?
The report for the vaccination is by residents. So no, not every single one of those seniors have been vaccinated here. They could have been vaccinated in any county in Florida, or even outside of Florida. They would still come to us.
Okay, so, all
But
right.
that's true for all the other counties also. So I think that it's still indicative of what Palm Beach County looks like. Because just as people get vaccinated, let's say Broward or Martin County or Gainesville, they get counted for us, but those counties also have people that have come here to get vaccinated because it's easier to get vaccinated here than where they are. So I think in the long run, those numbers can even out.
Right, no, I just, in the very beginning, this county was a bit slow to start, and so I would have to guess that a number of our residents were doing those max vaccine sites.
Yes, as a matter of fact, we know that it was a lot of the healthcare workers that ended up going to Miami and to Broward, to the hospitals, that were doing the vaccination. That is why we had several people that got the second dose before we even had second doses here. So we saw that. It was a small number, but we saw that. And we also saw the age groups under the age of 65 getting vaccinated prior to us starting, because they were getting vaccinated at the hospitals that have the sister, the big chains of the hospitals that were offering that to healthcare workers from anywhere in the state. They were coming down to Miami to get vaccinated. So that is true.
Okay, so when I look at this number and it says 195,484 total people vaccinated in Miami-Dade County, those are Miami-Dade County residents. That's
Correct.
not indicative of the total number of vaccines that they've actually put in arms, regardless of where people came from.
Correct.
Is there a way to get those numbers?
No, because they go into the county where the person resides. They wouldn't be able to pull that out.
Okay. All righty. Pahokee. We had a great opportunity just last Wednesday, and then another one in Belglade on Friday, and certainly want to thank the media for helping us draw so much attention to the need to provide vaccines in rural areas. The lottery secretary announced last night, and I did confirm with DEM pretty late last night, that they're going to be setting up a 500 vaccines a week, but vaccinating every day in Pahokee at the football stadium. So who's going to run that operation? And
The state will run the operation. The state has agreed to come and completely staff it and run it. I think it'll depend on the locals to do the scheduling and getting the people to go there. I do not recommend that everybody start going there, because then we're going to have people from all different counties going there. But however, we'll get shots in the arm in that area, and we can't prohibit someone from somewhere else coming to go there. So we're going to try to do the best we can in terms of scheduling to try to get as many people from our county there in terms of the Glades area. We're going to work with all the different groups that are out there, and I was thinking of going to your office to help us, because you have good connections there, to make sure that we're getting primarily our residents getting vaccinated who are out in the Glades who want the vaccine to go to that site. I will also have my clinic in Belglade will continue to do vaccinations also.
okay. Ms. Baker, can you tell me how we're going to handle that? Because right now, we've asked several times for the registration phone number, and there isn't one. So my office is actually handling all of that. We're getting the list, and then we hand it over to somebody who then calls that person back for their appointment time. So moving forward, is it still going to be my office that's handling all of this, or do we have better plans?
No, we found out when everybody else found out. That's the way the state handled that issue. So we've discussed it this morning. We are looking for another method in which to address that issue so that it is not just your aid working that is just going to be too voluminous. So we're going to be reaching out to some of our partners out in that area and try to put that to a third party that will handle the calls and the appointments, and not the county my staff is stretched really, really thin, and you know that. So we're going to be looking to potentially contract, if we haven't already contract with an entity to address this issue.
All right, I want to thank Mr. Crane from your libraries department who threw in some last-minute help last week, so I certainly appreciate that.
Yes. And along with my EIC staff, I don't want them to all quit at once, so I gotta come up with another method in which to handle this stuff.
Do we have any indication from DEM on how long that Pahokee site will be up and running?
I'm going to let Mary answer that. She's been talking directly with Jared over the last 24 hours.
Yes, Director Moskowitz stated that they had the interest to put that site up there. So we had learned a little bit of information that it was an interest. We didn't know it was definitive until we saw the same tweet, but we're excited about it. He had committed that they will keep that operational as long as there's a need. He does understand that it's a very rural, small population in that community, but they want to make it accessible. So he said he will keep it up and running as long as there's demand in that area.
Okay. Of course, my responsibility is to my constituents, and so making sure that the Glades area seniors that need that vaccine get that vaccine are the priority. But I will tell you, I visited the vaccination site in Okeechobee County on Thursday afternoon. They only received 500 vaccines for their entire county. Those vaccines were gone in less than 3 hours. They've got folks coming in from Martin, St. Lucie, and even coming up from Miami-Dade County. Indiantown. The mayor reached out through a mutual friend. They don't have anything in Indiantown. We will see people coming in from other areas around the lake simply because they don't have the same opportunity that we have. And so for anybody listening right now, I ask that you try to do, and we advocate for similar setups in other rural communities that are around the lake right now and actually across Florida. Certainly excited to hear the news about Walmart in Winn-Dixie. Walmart will definitely help Hendry County since they have one in Clewiston and one over in LaBelle. But the Winn-Dixie and Belglade doesn't have a pharmacy, so that still doesn't help us. So happy to see these other opportunities. But our rural communities, they're really getting the short end of the stick on this one. So just ask that if we want to make sure our residents are vaccinated, we need to make sure that other rural communities have the same access to vaccines we do. And where are we on opening the fairgrounds? Because I've gotten some constituents that have called a little concerned about their second vaccine cards and the location being changed to the fairgrounds, so they just want to make sure that that's actually going to happen.
They're scheduled to open. We've gotten the vaccine, so it's all a go. And every appointment that has been redirected to the fairgrounds, they will be able to get their second dose. There's no shortage of second doses for anybody, please. There's rumors going around that the second doses are not here, that they've disappeared, all kinds of crazy stuff out on the internet. We have no shortage of second doses. Everybody who's got a first dose can get their second dose. We recommend that they go back to the place where they got their first dose because that's who's going to have their vaccine. It's very important.
Commissioner McKinley, can I interrupt for just one moment and recognize our county administrator?
I was actually going to reemphasize the fact that individuals, wherever you got your first vaccine, unless you get a different notification from the health department or the healthcare district, you should go back to your original location. If you get a notice that your vaccine for their second dose has been changed, then go to the new location as readily identified by the health department or the healthcare district. In addition, for our Pahokee area, that state initiative is still coming out of the county's allocation. So it is not in addition to the county's allocation.
And the strike teams will go back to their original sites to vaccinate. Okay, those people will also be able to get vaccinated. Now, whether or not they set up the same sites or not, we'll talk about that to make sure, but anybody who went to the special effort that happened with the vaccinations, all the IMTs that were set up for state churches and things like that, they will be back at those locations.
So everybody that got vaccinated at the Dolly Hand in Belgrade on Friday will go back in 28 days to the Dolly Hand?
Yes, that's my understanding.
Okay,
They go back to where they vaccinated.
okay. And then the 28 days versus the 21 days, we're getting, I'm sure I'm not the only one getting calls on why that decision was made. I know you explained it last week, but there's still uncertainty in the community.
Yes, the CDC made some guidelines so people would understand that there is a window of safety, that you can give the vaccine up to 6 weeks with no interference. So it's safe to give it within 6 weeks. So if you were supposed to get it in 3 weeks, you can get it up to 6 weeks with no problem. But the healthcare district got a lot of comments that they would prefer to get them at the 3 weeks, and so they've accommodated their schedule now, and they will be doing it in 3 weeks.
Oh, wow. Okay, well, thank you for that update. Mayor Kerner, I want to thank you for sending, we made a decision as a board to send a letter to the governor with some of our concerns. In my case, the concern about the lack of Publix in the Glades community and the lack of testing opportunities. And you promptly sent that letter out, and we saw immediate action the following week. So I just want to thank you, and Ms. Baker, I want to thank your staff for getting that letter out so quickly, and that the efforts that we're seeing. And really want to thank Morgan and DEM Director Jared Moskowitz's office. Morgan has been wonderful to work with, and so has Jared, and they recognize the importance of vaccinating not only in our big cities, but in our small towns as well. So just want to give them a shout out.
Thank you, Commissioner McKinley. And as you know, the mayor just does what the mayor's told to do. So obviously, the letter came as a result of your advocacy and members of this board and taking a position to make a board position and notify the governor's office. So thank you for your leadership.
Well, Mayor, I'd like to point out, too, that if you look around, you're starting to be surrounded by more and more women. So we'll be telling you what to do more and more
I
often.
feel the wall is closing in as we speak. All right.
I will make a comment.
We'll go to Commissioner Sacks and then to Commissioner Weiss.
I love that statement, Mayor. It was really perfect. I have a medical question for you, Dr. Alonso, and it was sort of answered when Commissioner McKinley asked you, but I get a lot of questions about what happens, and I'm going to read it right off, what happens to those people who have a 4-week time frame to come back? If they've had the Pfizer and they're getting a call back after the 21 days, does that serve to minimize the effectiveness of the vaccine?
There's no less effectiveness on the vaccine. The 3-week change on the Pfizer starts with the first dose that will be administered on Saturday. So everyone who had received the Pfizer dose from prior and already has appointments, please keep those appointments, okay? They're going to start that change as of Saturday. So that's important, so I don't confuse people. But the fact that the CDC gave that guidance, and all vaccines have a period that is completely safe to give it on. It's not something that if you miss that day, your vaccine's not going to work. So it's a complete efficacy up to 6 weeks. So the fact that they're getting in 4 weeks is safe.
So there's, in essence, there's a 6-week window by which someone could get the second shot of Pfizer and still have the effectiveness of that vaccine, be
Up
be
to
effective.
6 weeks.
Up
You
to
don't want to
6
get it
weeks,
before.
right. Okay, good.
Okay.
That gives us a little leeway. And I would like to I'd like to commend Commissioner McKinley because of the good noise that Commissioner McKinley did. We were able to take care of those folks in Pahokee and in her district who's really needed the vaccine. And I think that all 7 of us are here sort of as representatives of our district. And when our district is not being taken care of, then the way that Commissioner McKinley worked it was extremely effective. And I was very impressed that the noise was already loud enough to reach Tallahassee. And by golly, she not only got the vaccines, but she got the governor there to make sure that the folks got at least some vaccines. We know that with a little more noise, we're going to make sure that they are all taken care of. I would also like to state that the 2 areas that were first given the vaccines here in South Palm Beach County, the big senior communities that used the strike force, they were very effective. And if we can, Ms. Baker and those of you in the healthcare district or emergency management can use that team again, I guess they're retired firefighters, worked very effectively. And I think I might have written a letter to that effect.
Yes.
But they know how to do it. They've been tested and tried. They did 5,000 at one senior community, 5,000. Could have done more if they had been allowed longer hours and, of course, more supply. So I just would like to put that plug in because they did a very effective job.
They're a phenomenal group, and it was made up of more than one team. We have a state team and then an independent person who handles, you wrote the letter for the independent company. But that's all they do. That's what they do. They go out. They were the same group that was here taking care of all the problems in the nursing homes and the ALF. So they're a terrific team. We got out of the vaccinations the other night at 10 almost close to 10:30 when the vaccine was brought in. One person, Alice, drove from Belle Glade to our warehouse, to our lab on where we have it stored, and then she had to drive back to Fort Lauderdale. They're stationed in Fort Lauderdale. So they had a very long day, and they do it with a smile.
Well, it's smart if we as a county will use those groups that have already been tried and true. And at Century Village and at Kings Point, this group of strike force were very effective in doing it. So as we progress on, we should certainly use what we have used before that has been very, very effective. And I'm just very proud, Mayor, of everything that we have done. 156,000 seniors vaccinated in this county, 30,000 in 1 week is going to occur. I'm very proud of my colleagues on this commission. And when we don't get it, we talk about it. And I'm very proud of all of you, Dr. Alonso, and also Ms. Glickman, welcome, and our Ms. Baker, to make sure that it's been effective. And there's always people who are going to complain, but the majority of people who have contacted my office have been very pleased. So I hope we continue in the same way.
We will.
Thank you very much.
Keep going on for a very long time.
Thank you for those comments, Commissioner Sachs. We'll move now to Commissioner Weiss and then to Commissioner Marino.
Thank you. Good morning.
Good morning.
Couple things I wanted to ask about. One is looking at the deaths in the county. Not sure how you all are calculating your numbers, but based on the chart you provided to us this morning, it shows that last week we reported 102 deaths.
The deaths, remember, are reported, but they do not go on the dates that they are reported.
I understand that.
So they go into the slots from the date of actual death. So you will never see that chart in the last 2 weeks. That chart remains always very low.
I'm not talking about your graph where we show by the date. I'm talking about the chart that Mary provides.
It's the same thing.
Well, it is and it isn't, because we talk about what the average death rates are. I don't believe we go backwards and pull those numbers back in.
Yes, we are
I'm telling
constantly
you
updating
because
the
week before that, it was 44. The week before that, it was 86. The week before that, it was 65. The week before that, it was 49. So the numbers they don't add up.
Yes, because they go backwards.
So you're telling me
for
we're
back-
going back and we're refiguring out the percent of people who died
Not
6
the
weeks
percent.
back?
We actually count the actual deaths that get reported by that date.
No, I'm looking at this chart. And it says, 2.1%, 2.2, 2.07. So are you telling me that that's getting recalculated?
That's how I've always counted it, and I think we have the same data. It's the number of deaths per day. And when the new deaths come in, you have to recalculate that graph every time.
I honestly, I don't see this. So I'm bringing it to your attention.
Okay?
And I want to make sure that the numbers that we're I understand the actual deaths are accurate. And the dates, I understand that it goes backwards. And as far as I know, based on the media reports, they can go back as far as 7 weeks.
Correct.
And they're averaging probably somewhere around 5 weeks for the state, because the fact that the medical examiner sends that data up to the state before it gets sent back down so that they can look at it and decide.
That's one of the reasons I have always made that if you look at the past 2 weeks, that's a misrepresentation. The graph always goes up and then it comes down very quickly. The last 2 weeks,
Right.
those should
That's
not,
why
we
I'm
shouldn't
not
even look
looking
at
at that
those.
graph, because it doesn't give us an accurate
Correct.
depiction, real time of what's really happening. Is there any way to get accurate information as what's happening in the last of real time of people dying from this disease?
It's the graph that shows it right there, because those are entered then into the actual dates of death.
But those are 7 weeks old.
That's how far back you have to go sometimes to put those counts in there.
All right, I'm curious. All right. And then do we know what the percent of our over 85s have been vaccinated?
Say it again?
People over 85 in the county, what percent of them
Yes.
have been vaccinated?
If we look at, let me pull my computer back up.
We show 24, almost
take,
24,000. Do we know how many we have?
If we take if we take the number of people on our COVID vaccination summary for Palm Beach County, we have, in the age of 65 to 74, 74,985. 75 to 84 is 56,004. And 85 and older is 23,682. That number adds up to 154,671. Our total population in Palm Beach County, based on the last data that we got from, I believe it was 2019, that total population was 346,044. So that's 45% of this population has been vaccinated over the age of 65. And that makes perfect sense, because that's where our large numbers are. All the other ages is like 1,000. The one that comes closest is the 55 to 64. That's 13,820. So
So I'm
154,000 out of all the people that we have vaccinated in the age groups, out of the percentage of the 65 and over that is the population in our county of 346,000 is 45%.
Do we?
Now
do we know-
that's-
Do we know how many people 85 and over we have in our county? I'm interested in that demographic, and let me explain to you why.
Okay.
I'm concerned that we have them they're living in what I found is people are living in not assisted living or CLFs, but they're living in independent living. And they're obviously very elderly. The potential for them of getting this disease, of dying, goes up much higher when they're of that advanced age. But my concern is them not getting vaccinated, found instances because they don't qualify for those federal programs. And so I've gotten calls from children regarding their parents in their late 80s, early 90s, and saying, how are they getting vaccinated? They don't drive, they don't know how to use a computer, and what can you do? And so my question is, do we know how well we're doing with that population, and do we have any special types of things that we can be doing to make sure that they don't get overlooked because of their lack of access to technology or the ability to be mobile?
Yes, we'll get you the number for what that number for the population over 85 is for Palm Beach County. I don't have that. I didn't have access last night to that data that we can probably get from the county. But we are doing several things for that. In the future, when there's sufficient vaccine, one of the issues is the homebound program that we expect to set up. Right now, there's actually vaccinations going on with homebound. Palm Beach Fire Rescue is working on that, and I will let our county administrator tell you how that's going, perhaps. Or the fact that the fire rescue is doing that kind of activity right now with the special issue that the state sent for us.
Vice Mayor, do you want me to answer?
Absolutely, please answer.
We do not have our homebound program set up as of yet. Our fire rescue department is working with the state initiative on the Holocaust homebound. And so that should be wrapping up soon. I do know that our fire chief is working with other fire departments, and we're coming up with a strategy on how to handle our homebound. Our first challenge, I shouldn't say challenge, our first opportunity is to define homebound, because we cannot go to everybody's home knocking on doors. We just don't have the staff, even if we wanted to go out and bring in help. So we need to, we're defining homebound, and then we will work from there. I am aware that one community that has elderly people in it have requested that we come into their community. Again, supply is the key, and when we can work those particular type requests out between supply and working with the healthcare district with the mobile units, we will attempt to do so. But right now, we're looking at trying to get the masses through those 4 sites, really, because we'll be adding North County site hopefully next week, and try to get through those masses. And then when we get additional supply in and we're able to work through and get additional people through the healthcare district to go out on the mobile units, we will start to tackle that. But that will not be anytime soon.
I don't want them to fall off the radar. I mean,
No, sir, they're not.
It's I know of a facility. I mean, they can have hundreds of residents in these independent living facilities, and so they're at a higher risk.
They will not fall off the radar, I can assure
There's
you.
also home visiting providers that are very interested. Some of them have a list going for people to get on their waiting list. And they have worked in other counties, and there's certainly many that are here. As soon as vaccine is made available to the providers, they're on that list because they're Florida shop providers. So once that opens up and they can get vaccine, they'll be able to vaccinate people by going to their home.
Can you send me, or send us all, maybe a list of who those folks are so we can let these independent living facilities know who they need to be in contact with?
I know of 2 that have been calling us, but yeah, I can find out how many we have here in the area.
Okay, thank you. Thank you.
Thank you. Commissioner Marino, you're next.
Thank you. Oh, good morning. How are you?
Fine.
Ms. Blakely, welcome to the new post. Okay, couple of comments, couple of questions, and you know me, I'm the numbers person, but one is, I want to say that my 85 and 88-year-old mom and dad, who did the CDH 55 feedback, got their first shot at the Clematis address.
Okay.
They're getting their second shot today at 1:45. The reason I'm bringing this up is because they got a confirmation phone call on Saturday that confirmed their location, which actually changed. So I hope that answers questions about where the people go for their second shot. They, as we said, they did it at Clematis on their first shot. They are going down to Lake Worth. They actually drove down to Lake Worth last week to see the location and make sure they didn't get lost today. So I'm happy that they are getting it, and it's been a good experience for them, even though my mom did react to it, but hopefully she won't react to this one. I do want to also say that we have received a lot of letters from people saying how efficient the system is in getting their shots and how quickly they've gone through the process. So I know while we're taking a beating, I do want to also point out that I have received numerous letters of people saying thank you and of people saying the process went well. And I also want to say thank you for the people that have emailed all of us asking where they are on the waiting list, and for your folks to actually confirm where they are. So it gives people a little bit of comfort. I do want to note a couple of things. One is we have 111,000 cases recorded here. We've actually vaccinated 190,000 people. So we've vaccinated almost twice as many people who have had COVID. So I think that's a good number. A question about bringing the vaccine. How long, I know when we did the walkthrough at the fairgrounds, and we were told that the vaccines were not going to be on site, they were going to be brought in regularly. How long is it, once you take it out of the refrigerator, that you can then transport it someplace else and it still stays viable?
If it stays refrigerated, then it can go back to the refrigeration for Moderna, and you can keep it for 30 days. But once the vial is punctured, it has to be used within hours. So if you actually open the vial, then you have to use that vial while you're there.
I guess maybe I wasn't clear on the question. Since there are not going to be any vials at the fairgrounds, that they are being delivered on a daily basis to the fairgrounds, because as we were told, there is not that type of refrigeration system at the fairgrounds. Correct me if I'm wrong, because I don't want to go down a path if I'm incorrect. But I just want to know, once you take it out of the sub-freezing temperature, what is the length of time it can stay out of that sub-freezing temperature? So if we're driving all over, as you said, from Pahokee to Lauderdale or whatever, I just want to know the time frame that it can stay out of that sub-freezing temperature.
They're keeping it in coolers while they're on site, but not the deep freeze, because it has to be thawed out in order to give the vaccine. So it can be kept there all day with no problem at all.
And that would be the same thing if you had to run it from one end of the county to the other end of the county, or
Yes.
to Broward or Dade.
We do that all the time. As a matter of fact, the original distribution was that they would have centers like Broward, Orlando, different areas, and it would be a constant driving. When they come and they pick up the vaccine, it's for that day. So they come early in the morning, they pick up the vaccine from us, and then they go out and do the vaccinations. That's why we waited till 10 o'clock to receive all the vaccine that was coming from the sites the other night when we did it on Friday, because we wanted to make sure we stored that securely in our freezers so that we could use, those vaccines are good for 30 days.
Okay. Now I'm going to go for my plea for District 1. as you know, we have 7 districts. District 5, their average age in their population is 63. District 4, the average age of their population is 53. And District 1, their average age is 51. But District 1 seems to be the redheaded stepchild when it comes to getting vaccines. I mean, I'm glad my parents, who are 85 and 88, can get in a car and drive down to Lake Worth because there is no vaccination site in the north end of the county. And I know I've pleaded and asked. I guess I haven't done it violently enough or loud enough, but District 1 needs a site. Now, having said that, I know we also need the vaccine to be at that site. But I can't plead hard enough for District 1. I mean, we do have one of the highest populations of, older folks, and we don't seem to be getting the vaccine up there. So what do I need to do, and who do I need to plead with?
You want to take that one?
I know I'm a broken record, but
How close,
you're-
so we don't have
no,
to have...
you're not a broken record. We have a significant number of Publix located up in the north end of the county. In addition to that, you will have a site at the Palm Beach State College off of PGA. We anticipate that particular site being ready to be up and running by the end of next week. And that is something that we have been working on. We needed to work out the logistics with the state college, but that has been in the plan to set that site up on the north end of the county.
and that will be staffed by whom?
That we're working through. The primary lead will be the healthcare district. And we may reach out, just like Palm Beach County Fire Rescue Department works with the healthcare district in all of the other locations. We will be reaching out once we get everything all lined up. We'll reach out to the fire departments up in that area to see if they can augment the healthcare district.
I can help you facilitate that if it's necessary.
I will definitely not hesitate to ask you to assist, absolutely. And you did make that offer before. We just needed to get our ducks in a row before we reached out.
I appreciate that. And, I know that there are Publix all over the county, but like everybody says, it's really not an easy process to get on and get an appointment at the Publix website. And even though there may be some in the Gardens, people may be coming from the south end of the county to come to Publix in the Gardens, so, or in Jupiter or Tequesta, wherever. So I appreciate that, and I believe that is all of my questions. Thank you.
Very good. Thank you, Commissioner Marino, for your comments. Vice Mayor Weinroth, you're recognized.
Thank you, Mayor. A number of us were over at the State Fairgrounds last week, and it was an impressive facility, and certainly we're looking forward to seeing that up and running. One of the things that we can tell our stakeholders is that the healthcare district is making available an online registration so that when the people arrive there, they won't need to fill out paperwork, that the information that they're keying in at the portal will then be used to prepare their registration materials. If they weren't able to complete it fully, there's a kiosk there available for them to key in their information. And if they are not computer savvy, there will be people who can write the information or key it in for them. So it's a very impressive facility, and I'm looking forward to that opening up on Wednesday or Thursday, whenever that comes up. One of my concerns right now is the disparities that have continued to crop up in the rollout, and I think that Commissioner McKinley and Commissioner Weiss have alluded to it. We have a population that is not comfortable on the computer, either doesn't have a computer, or if they get on a computer is very quickly frustrated by the timeouts that occur. And I've gone onto the public site just to see how it is, and I've seen that, you'll get onto the site and it tells you to wait, and 45 minutes later it says all gone. So, I can understand the frustration that is part of this. And we need to understand we have a segment of our population that will not be able to handle the online portal. And so we have sort of danced around this issue, and I know that you've said that, well, if they have a friend, they should have the friend help them, and if all else fails, we do have a phone number. But we need to make that more accessible. And again, as we're getting this bulk of people, and I'm impressed by the number of people who've so far received the vaccine. So obviously, we are getting the vaccine out, but there is that segment of our population that cannot get access to it. Probably the more elderly of our population, those 85 plus, 75 plus, 65 plus. And we need to do something in a more organized fashion so that they feel that there is some way of working with them. It shouldn't be incumbent upon our staff to be taking the information and then transferring it to either the healthcare district or the Department of Health or to Publix or to Walmart. And I'm pleading with you to establish a system and a phone number or whatever needs to be done so we can embrace these residents who are feeling left out. Is there something you can do to help us with that?
Yes, that has been done, especially through the health department. We always have had those clients. So the state side does have a telephone number where they can go. It's 866-201-6754. And they can call and get on the wait list for Palm Beach County for the state.
Now,
Okay.
you're saying that's the wait list for the state, as
Yes,
I understood.
That's a telephone number so that they don't have to go through the website. And of course, our appointment number is 561-625-5180. Now, we do not have the 8,000 operators like the state does, or 4,000, however many they have. So if everybody calls at the same time, we will not be able to answer their calls. We take 50 at a time, and then it goes into a wait. So we have had that number available all along. We answer their questions, and we can put them on wait. And so we would refer them to the state line so they can get on that system. So in order for them to avoid the frustration of going back and forth, if they call the state number, I'm going to repeat it so that everybody has it. It's 866-201-6754. That's the number to call to get on the wait list for vaccines here in Palm Beach County.
Now, let me just clarify, and I think this is from the last meeting we had where we discussed these buckets of names that are in these virtual waiting rooms at this point. This bucket that you're speaking about now, they call the 866-201-6754. That is not being tapped into at the moment. From what I understood to be said to us before, they're sitting there waiting until healthcare district finishes off on the list that you had accumulated from the email list that you had from December and January.
That is absolutely correct, and we promised those people we would do them first, so this is a way of doing it in order, and that wait list is also by the date they call in, so that will be, in other words, the state replicated exactly what we had here at a state level.
So the people who call this phone number, and again, the number is 866-201-6754, they should not expect to be getting an appointment for about 6 weeks, because according to Darcy Davis, they need about 6 weeks to get through the list that they accumulated that you handed off to them. Am I correct?
Yes, let's not tell them 6 weeks, because I guarantee you there's another 100,000 already for Palm Beach County there. So let's not give them false expectations.
So minimum of 6 weeks until they should expect. So if they are able to get an alternate appointment at Publix or in another location, they should take that appointment and you'll skip over them if and when they're going to be called.
Yes, and many of them have done that, and that's why we're having a lot of cancellations. Remember that Publix, as hard as it is to get in there, they're vaccinating about 19,000 people per week. Is that number still correct, Mary?
Yeah.
okay? And they're publishing those numbers, so they're being very transparent about what they're doing and how they're doing it. And I'm very grateful. That's 19,000 people that are getting vaccinated that, you know, it definitely makes a big dent. And I think all of that together with the number of people we're seeing and the high number that the healthcare district is seeing is why we're going to be ahead of Dade this week, I think.
Yeah, and if, Vice Mayor, if I could just add to that, in our conversations with Darcy Davis and the healthcare district, when they have completed the process of going through the list provided by the Department of Health, and when they get to the point where they can open up their registration system for people to book appointments at sites that they'll be doing here for us, at that time, they're also going to include a phone number as well. So they know that that's an issue, and they're working to resolve that issue, and we'll have a phone number available in addition to being able to do it right within their website.
Okay, and if someone, excuse me, has the healthcare district's website and went on and put their name there, unless they are on the list that you had created from the emails, they will not be called for vaccination. Is that correct?
To me, that is another wait list. They will take people from that list when they open up their registration, because those people are in line, and they will honor those people that are in that line.
Now, the phone number that you gave us for the Department of Health, 561-625-5180, what happens to the people who do get through and are giving you their information? Where are they placed in the wait list?
We're going to refer them to the state line so they can get into that wait list, because it makes no sense to have another wait list created. So we're going to give them the state number, which is what I recommend that they call.
So just so to manage their expectations, if they call either one of these phone numbers, they should not expect that they're going to be called for an appointment for a minimum of 6 weeks.
Let's say a few months.
All right, I just want to make sure that everybody understands, because again, we get emails constantly, I'm sure you can understand, where they said, I've sent my name into the Department of Health, Healthcare District, 3 times in the last 4 weeks, and I haven't heard anything. And our staff is telling them, well, you're not going to until they've worked down the list that the Department of Health had accumulated.
That's correct.
Okay, I just wanted to make sure that that was understood. And again, I appreciate this, and certainly I'm expecting once Walmart and Sam's Club and Winn-Dixie come online, along with Publix, that's going to take a lot of the pressure off of the healthcare district as they're doing their work. But the healthcare district, of course, has the capacity to do 7,000 people a day if they had the vaccine. So we certainly, as a county, are ready to vaccinate a lot more people. But let me ask you a question. I was looking at the statistics for last week. Why were there only 3,200 people vaccinated on Sunday? Do we shut down most of the vaccination sites, or what's occurring that would have been so low?
I don't see, what are you looking at on Sunday?
I was looking at the site that's discoverpalmbeachcounty.org. They have for every day the number of vaccinations. On the 7th, there were 3,200. Comes to the same number you've reported today, 190,770. Of that, 3,200 were on February 7th, 6,200 were on February 6th, and 3,900 on February 2nd. So these numbers are all over the place, and I'm trying to figure out why on Sunday it would be 3,200. Is it because we're shutting down operations?
Yeah, if their vaccinations arrive at the beginning of the week, traditionally first doses on Monday, Tuesday. So if they go through those within that week's time frame, they will not have latter in the week or weekend vaccination appointments.
Do we know from the healthcare district how many people they're going to be able to accommodate on Wednesday or Thursday when they start the new operation at the fairgrounds?
I don't have that number off the top of my head. Do you know if they're aiming for a certain number?
I believe when they start at the fairgrounds, they're going to start, because they're going to build up to what they can get to. I believe their first day of operations for first doses out there, they're going to be doing 550 and then build up to over 1,000 after that.
Okay, and they're doing second doses there also?
Correct,
Okay.
correct.
And again, to emphasize to people who are watching, please don't walk in. They will not be accommodated. You have to be registered to be vaccinated. One of the things, and I understand the two of you are putting numbers together and not necessarily out of the same pot, excuse me, or they should be the same pot, but the numbers you're giving us are not reconciling against each other. And I call your attention to two numbers that you both gave today. One was the percent of daily lab positivity. Dr. Alonso, you had said the average was running about 7.79, and Mary, you had said 7.18. That discrepancy, while it seems small, we have residents who are calling us, and they're focused on these numbers. The other number you gave today, Dr. Alonso, you gave the number of 15.71 for the percent of positive total tested, whereas Mary, you gave 15.67. So I'm just going to ask, if we're making a presentation here, if there's some way you can reconcile these numbers so that we're all looking at the same numbers.
Yes, I use the sheet of paper that comes to all of you every day. Ed Chase puts that together. Where's Ed?
Ed's hiding.
There he is. He's very meticulous, and he's the one that updates those numbers every day, and he reconciles the deaths and everything else. He's definitely the guru for all our data. And that is our percent of positive, the total tested is 15.71%. I gave you the average from January 25th through Sunday, February 7th. So I gave you an average of 7.79 for the daily lab positivity.
And just to let you know, it could be a difference of a day. We pull, for the reports that have been provided by emergency management, we pull the data on Monday night off of the DOH website. Our GIS staff do that, and that's how our reports are compiled. So I think it just might be a timing issue, but we'll definitely work together to reconcile that going
Right,
forward.
especially when you're sitting side by side, it would be, better for credibility. And again, I want to thank you. It's obvious that we are making headway. We are seeing that a larger percentage of our residents are getting, are getting this vaccination. But it's important that we not allow those people who are not internet savvy to not be left behind. And I appreciate these two phone numbers you gave us today, and implore those people who have somebody who can help them to try to get on the public site, because certainly they are getting the largest volume of current appointments. The appointments through the healthcare district are going to be deferred, as the good doctor said, almost 2 months. So people who are looking for those vaccines right now certainly should be using Publix, and as soon as Walmart and Winn-Dixie open up their sites, to try those sites as well. Thank you, Mayor.
Very good, Commissioner Bernard. Then we'll close with Commissioner McKinley and move on to the regular agenda.
Thank you, Mr. Mayor. Dr. Alonso, I just have a couple questions. You had mentioned in regards to the second dose for, like, let's say at Tabernacle, I believe that the second dose would be this Saturday on the 13th. Since those are special projects, they go back to Tabernacle, is that correct?
That's correct.
And who's scheduling the appointments for those residents that would go back to Tabernacle?
When they gave them the first shot, they should have told them what day they needed to come back to Tabernacle.
Yeah, but they have the date, but they don't have the time. So do they just show up, or how does that?
We have been scheduling it on the same time that they had their appointment. That makes it very easy for them to remember. If you had it at 9 o'clock, come back at 9 o'clock on such and such a date. I don't know how the IMTs did it, if they did that same method or not. What we should do is contact the folks that help set up those appointments for people, so that they call them and remind them and make sure that the Tabernacle is set up for their location and how they're going to flow and everything, so that the hours of operations are correct. I know that this last Friday, there was a lot of confusion, because at one point they were going to be open from 8 to 8, and then they closed earlier. Some people didn't make it after work and so forth. So it's very important that we nail those times down, and that the folks are able to call those people by phones and be able to reassure them that their appointments are coming up.
Now, I believe like at Tabernacle, let's say about 200 of those residents were walk-in. So the people who set the event probably wouldn't have those phone numbers for those other residents that were walk-in. How would they, is there a way for, how can you get their phone numbers to set it up?
Those individuals that were walk-ins should come with their card to show that they got their first dose, and then they will be accommodated for their second dose. But I think that's something that the specific site has to set up and have that conversation. And there's a list with the registration, when they filled out their registration, and all that information is asked on there, so people can always go back to the registration forms and
But
look.
those registration forms, they go back to the IMT, I believe. So how would they have those information?
They need to contact and get that information so that they can find out the whole list of people that they have available for that second dose.
So working with emergency management, would we be able to get the list, so in that way we can, so someone from Tabernacle would be able to contact them? Is that possible?
That's what I would recommend, that they have that communication with the person in charge of the team that came to them.
We'll
follow
follow up with
up.
the state, and we'll find out. It was my understanding that all of these special projects that the state is doing, that they are doing it from beginning to end, including making second appointments, but I'll make sure that we have clarity on that.
Yeah, I'm not sure if they were making the second appointment, so I think that we need to
Yes,
kind of
because
like-
their vaccine is already waiting for them. It's very similar to what they did at Kings Point Century Village. The team that gave the vaccine comes back, and they have it organized, but it's up to the location that sets this up for the appointments. They're there to give the vaccines.
Commissioner Sacks, did you want to be recognized on this point?
Yes, I do, just on this point, if I could. And Commissioner Bernard, those points are well taken. I have so many emails from folks wanting to know if they both register on one email, but one person is called and another. Let me suggest something, Mayor. In Miami-Dade, they have a group who, they're volunteers, they're not paid, but who assist people who have these questions. These are good questions. And these are questions that need to be answered, especially for people over 65. They get very nervous, and every one of us up here have gotten emails and calls. This group is a group of volunteers who know the answers to these, or at least know where to get the answers. And so what happens is that all these questions are referred to them, to this group of volunteers, and then they respond to that. So I wonder if we could, I don't know the protocol, but if I could just request that maybe we look into a situation like this, where we would have a group of volunteers who could assist Dr. Alonso and, of course, Ms. Glickman and everybody else, and everybody here. I have reams of questions I could ask. We would, be all day here on these little things that Commissioner Bernard was also, and our Vice Mayor. So I wonder if we could just maybe review this, research this, and see if we could come up with a group of folks who would be able to respond to inquiries by the people of Palm Beach County on how to, proceed, getting their what number to call, as Commissioner Weiss has. In other words, to help out. I know it's been very successful in Miami-Dade, and I would just request that maybe we review that, Mayor, with your approval.
And I think that Commissioner Marino might be the first volunteer, is that right? Unless there's objection from the board, if you don't mind me working directly with the county administration on that and to maybe cultivate some ways to get a broader FAQ or volunteers involved, because I know that you've always welcomed that assistance as well, I think.
Yeah, you have to remember that all those emails you get, we get also. Joanne gets every single email you get. I get copied on it. And the phone calls, the phone's ringing all day long, and they're answering those questions all day long. So you can never have enough people taking calls.
And people want to hear back, and they
Yes.
want to hear a human voice, and I certainly understand that. So we will report back on that. Commissioner Bernard, you continue to be recognized, sir.
Thank you very much, Mr. Mayor. Dr. Alonso, I know in the past couple of weeks, you had mentioned that, the population that has been vaccinated, in terms of the black population was 3% and 4% on the Hispanic side. Kind of like, where are we going in terms of the trajectory, in terms of the black and the Hispanic population? And because the reason why I'm asking that is, I know that it seems to me that about 9% of the 65 and older population, about 9% is black, and about 11% is Hispanic. And I just don't think that the numbers are at that 3 or 4% right now. And just kind of like tell us how we're doing and where we're going.
Yeah, I was very disappointed to read a story in one of the papers that said we were going backwards. We're actually not. We have vaccinated a very large number of our population. I think the part that makes our numbers a little difficult to reconcile is the fact that we have so many that are in the category of other and unknown. So for the population over 65, if we use that total as the 346,044, that means that we have vaccinated that number of the three age groups being 154,000. That means we've vaccinated 45% of our total population over the age of 65. That is very significant. And if you do the same math with the white, black, and Hispanic,
Dr. Alonso, I think that based on my math, based on the numbers, it seems like in terms of the black population and the Hispanic population, it seems to me that we're about 12 to 13%. So am I looking at it wrong, or?
No, I think we're at 17 and 18%, 17 for black and 18% for Hispanic. The problem is that unknown. So everybody's going to question, well, who are those unknown? And if you can see that, but I agree with you, it's much higher. It's definitely not 3 or 4%. That 3 or 4% was of the total population of Palm Beach County using the 1.496 number, right? Mm-hmm. But we got to look at the percentage in the 65 and over. That's who we're vaccinating. So I agree with you that calculation, if you use the population for black population, 30,874, and for Hispanics, 39,314, then if you put in the numbers for the black and the Hispanics, the 5,000 and the 6,000, we're at 17.
I wouldn't put the full number, because you still have a good number of healthcare workers who are under the age of 65. So that's the reason why I went a little bit lower, because, accounting for the people who are under 65, who are black, who are Hispanic, who have been vaccinated. So that's why I'm a little bit lower than adding them all.
Well, I'm using the number that I have. It's hard to distinguish, how many black doctors got vaccinated. We wouldn't be able to decipher that out. So I agree with you. But the point is that it's much higher than 3 or 4%. It's certainly at least in the teens, and the population in that age group, the numbers are significantly much lower than our general population.
Okay. And, I know we had this event that we did this past Friday, and, just I know that I want to thank you for your leadership in terms of, shifting those vaccines to the 6 sites that we were able to do. And, just want to thank the governor's office for working with us, Governor DeSantis, Jared Moskowitz, and the whole emergency operations team, Mary, being there. I think we were there till like 1 o'clock in the morning on Friday.
Yep.
And, Ms. Baker and John Van Arnhem and Todd, the whole team. And but a special thanks to Lisa Wilson from Commissioner McKinley's office, going door to door and knocking on the doors, Tammy Jackson Moore, and just working really hard to really get the residents in the Glades vaccinated, and pretty much thanks to everyone who worked on the different sites. So, I believe that the trajectory, we're doing better, and we're just going to continue to, we're at 45%, and I think that we can get to 75% of the 65 and older before they open up the next slot. So.
Well, thank you very much for bringing that up, because I was a little disappointed to see the newspaper say that we were going backwards. We're definitely not going backwards. We're way ahead. And I can tell you that this is not happening in other counties, okay? I can't thank this commission enough, and mayor and county administrator. There has been phenomenal support for this. This is unique to Palm Beach County.
Thank you. Very good. Thank you, Commissioner Bernard, and thank you, Dr. Alonso, for those comments. We'll go to Commissioner McKinley and then to Vice Mayor Weinroth.
Commissioner Bernard, I want to thank you for that recognition. I'd like to say that we've advocated assertively and efficiently. I certainly wouldn't use the word violently, but just been very assertive. And it certainly helps speed things up to have a former NFL player and hometown hero, Anquan Bolden, lend his name to this effort. But I can tell you that when we got the news that that was happening, the first phone call from his foundation went to Tammy Jackson Moore, and the first phone call from Tammy Jackson Moore came to me. And Lisa Wilson and Tammy and I worked those phones the night before the event with less than 12 hours notice that it was going to happen, to make sure we had a good turnout in Pahokee. But Lisa has been absolutely phenomenal. She's born and raised in Belle Glade. It is her home. She's got a special relationship with the mayor out there, but she's the leader in her own right. And I just really commend her for the work that she's done, and for Tammy Jackson Moore. The phone number, I've had a lot of calls of people asking me for the phone number for the Glades. It's my office, actually. So I'm gonna give it out. It is 877-930-2206. That's 877-930-2206. I would ask the public that you really use restraint in calling that phone number, recognizing that it's one legislative aide answering that with the help of 1 or 2 staff from the library, and that you really, it's meant for the residents in the Glades to be able to have access to a vaccine in the Glades. And so I bring that up because one of the reasons we sought that localized access was because of the lack of transportation for a lot of these residents to be able to get to the coast and to some of the vaccination sites, and to, obviously the lack of Publix was a driving factor. But we keep making these drive-up vaccines. I know I reached out to DEM on Thursday and said, hey, we had a great event, we made it a drive-up, but the whole reason we needed the event was a lack of transportation for so many. So when we're setting up these drive-through sites, we need to make sure that we have an option for anybody that's coming in on PalmTran, or that may have taken an Uber or a Lyft or some other form of transportation other than a personal vehicle. And make sure, I think when we say we don't want walk-ups, we mean we don't want people who don't have an appointment. Let's just be very careful in the terminology that we use. and make sure that we have those options. And then I would also just agree, when your district is 1,692 square miles of Palm Beach County, is just about 2,500 square miles, and it's 70% of the geographic area, and it touches 5 of the other 6 commission districts, it's easy to advocate for a vaccine location in any part of the county. I'm certainly excited. The fairgrounds is probably one of the most central locations in this county, so very excited. But my district also extends north, and it does include parts of the city of Palm Beach Gardens and the northwestern parts of the city of West Palm Beach. So I would join Commissioner Marino and look forward to you guys getting that site set up at the Palm Beach Gardens campus of Palm Beach State College. Want to thank Palm Beach State College for being our partner too. I know a certain new mom who's been trying to enjoy her maternity leave, but also having to help set up and coordinate some of those efforts. So big thanks to Rachel on that one. But my last comment, Mayor, and the reason I really pressed my button was not for all of that I just said, but it was, we owe a huge debt of gratitude to Commissioner Bernard. All of these church outreach efforts, he has been very quietly but 100% hands-on, working behind the scenes to make sure that those are a success. And so, Commissioner Bernard, on behalf of my constituents in my district, just want to thank you for that.
Thank you, Commissioner McKinley, and I know we all share that sentiment about Commissioner Bernard. Vice Mayor Weinroth, you're recognized, and then we'll move to the regular agenda.
Thank you, and I don't want to play gotcha, but my assistant has been trying that phone number that you had given us earlier, 561-625-5180, and has not been successful getting to someone in the last 25, 30 minutes. So I understand that this is not supposed to be used except in a situation where you have no other means of making contact and making an appointment, but we need to do better. I know you've had trouble with the system. It's a state system that you have been inherited, saddled with, whatever you want to use for the terminology, but we need to do better. And if my assistant can't get through, then there are a lot of people who are much older and much more feeble and much more frustrated, and we need to give them an opportunity to get through. So I ask you to please take a look at that.
I guarantee you, as soon as you gave it, everybody called it. So
That's
I would suggest that you all, everybody out there and
Everybody take a breath, right?
watching, do a little lotto spin on a clock and decide to call at a different time during the day, and you will get through.
And again, like I said before, obviously in gross, we're doing very well, but we worry about these pockets. Obviously, as Commissioner McKinley and Commissioner Bernard have been working, so have I and Commissioner Sachs. As far as in District 4 and 5, we have the Holocaust survivors down there. We have shut-ins that we are focused on getting them their vaccine at home because they are not able to leave their home. So we're going to continually have these pockets that we need to identify and get them, as well as the people who are going to be able to go to Publix and these other sites. So again, I thank you for everything you're doing. I thank you as our partner, and someday we're not going to have these updates.
Very good. Thank you, Vice Mayor Weinroth. That concludes the special presentations under 4A. I'd like to thank Dr. Alonso of the Florida Department of Health, and of course, Mary Blakeney, our new emergency manager for the Palm Beach County. Obviously, we're making some real progress in this county. That should be anticipated, and improvements should be anticipated as well in terms of supply chain. And I thank the board for their advocacy and leadership thus far. We're going to move now quickly to agenda item 5, public hearings. There are no public hearings. A final reminder that as we move into the regular agenda, to submit comment cards prior to the start of that agenda item. Just for clarification, Madam Administrator, is a motion to receive and file the proof of publication required if there is no public hearing? Very good. We'll move now to agenda item 6, which will be the regular agenda. And based upon the adopted agenda, we're going to move to page 30. We're going to do 61, which is found on page what? Page 36. Very good. So that is 61 related to the Lantana Airport jet ban. And we have here today Ms. Laura Beebe, who is the Director of the Department of Airports for Palm Beach County. You recognized.
Good morning. Good morning. Today, we're recommending approval of a corrective action plan required by the Federal Aviation Administration in final agency decision in the Foreman versus Palm Beach County case. We have a brief presentation, which is going to include introductions and a brief agenda. So we will be going through a pretty quickly an agenda. We thought that this is a very important issue to make sure that the community and the board is fully advised of the consequences of this decision. It's not something that we have brought to the board lightly. It is probably the hardest recommendation I've ever had to make to the Board of County Commissioners in my 20 years with the county. So this is not something that we are taking lightly. We'll do introductions. We'll provide a brief legal history of the Lantana Airport jet restriction. We'll give you a brief overview of the FAA final agency decision. We'll provide the potential responses to the final agency decision as recommended by our outside counsel and by the county attorney's office. We'll also provide an overview of the recommended corrective action plan, and then also talk about the practical implications of the corrective action plan. And then finally, next steps. As you all know, I'm Laura Beebe. I'm the Director of Airports. With me today is also Ann Helfunt, the Assistant County Attorney for the Department of Airports, Gary Sypek, our Deputy Director of Airports Development, and then we also have a virtual attendance by Peter Kirsch. He's an attorney at law with Kaplan, Kirsch, and Rockwell. His practice focuses on airport-related transportation issues with a particular emphasis on noise and environmental impacts at airports. He has been working on noise issues for Palm Beach County for more than 25 years, and I might say successfully. We also have today with us Mary Ellen Egan, virtually. She's the president and CEO and chairman of the board of directors of HMMH, a transportation consulting firm. Her consulting practice focuses on the environmental impacts of aviation with particular emphasis on noise mitigation. She has provided noise consulting services to the Department of Airports since 1990 and is also the consultant on our current Part 150 noise compatibility study for the Lantana Airport. So I'm going to turn this over to our attorney to go through a brief legal history of the Lantana Airport jet restriction.
Good morning, and I assume you can all hear me okay?
Yes, sir, we can.
Thank you. This is Peter Kirsch. It's a pleasure to be here this morning virtually. I'm sorry I can't be there in person. What I wanted to do is walk through a little bit of the history of the Lantana Airport jet restriction and then talk about the specific issue in front of us today. As many of you may know, the restriction on jet operations at Lantana has been in effect since 1973, and we've spent about the last 25 years defending that restriction against a series of challenges, and we've been successful in all of those to date, but to telegraph to the very end of the presentation, we've reached the end of the road on that effort. Just briefly going through some of the key dates that have occurred over the course of the last several decades. In 1973, the county first adopted the restriction. In 1988, because of a clerical error, the Board of County Commissioners adopted new regulations for the airports in Palm Beach County without codifying that restriction. In 1991, that restriction remained in effect, and Palm Beach County and the city of Atlantis signed an interlocal agreement that provided that Palm Beach County would continue to enforce the jet restriction to the extent permitted by federal law. In year 2000, we got our first formal administrative complaint challenging the use restriction in what's known as a Part 13 proceeding filed with the FAA. That case was never decided. Again, the issue came up in 2016 when another Part 13 administrative complaint was filed with the FAA Southern Region. That was decided adversely to the county, and in 2017, a Part 16, which is a more formal administrative process, a complaint was filed with the FAA. That decision came down in March of 2019, and the county appealed the initial decision, finding that the restriction was unlawful. That was appealed to the FAA's Associate Administrator for Airports, who is a senior decision-making official at the FAA on such matters. And the FAA Associate Administrator issued a decision in January last month, finding that the jet ban at Lantana is unlawful and ordered the county to rescind it. If we can go to the next slide, please. The final agency decision that was issued in January directed a couple of things to the county. Number one, the county was directed to submit a detailed corrective action plan within 60 days. That 60th day is March 14th. That corrective action plan must permit immediate access by jet aircraft who can use the Lantana runways and infrastructure. And it must provide a long-term formal commitment within 180 days to rescind or not enforce the restriction. So there's really two parts. The first part is within 60 days, provide immediate access, and then a permanent rescission of the ban within 180 days. Pending FAA's approval of the corrective action plan, FAA has notified the county that it will withhold approval for any application for grant funds to which the county is entitled. And finally, the FAA said that it would consider appropriate additional action regarding the county's non-compliance with the Airport Noise and Capacity Act, an action which by the FAA could jeopardize all county airport grant funds. The FAA has not done that, and we don't know when or whether they will. If we can go to the next slide, please. Now, the county has a couple of options when it comes to responding to the final agency decision. The first and most obvious is to submit the corrective action plan to the FAA within the required time frame. To do so would require no further action by the FAA, and it will provide for the ultimate rescission of the jet restriction once the FAA approves the corrective action plan. As Mary Ellen Egan will describe later in this presentation, we expect limited jet activity because of the operational constraints of this particular small airport. And in fact, noisier aircraft and aircraft with comparable noise levels already operate at this airport, so we are not expecting, by the rescission of the jet ban, to see any significant change in the noise environment. The impacts of jets, along with all other operations at Lantana, are being considered as part of the ongoing noise compatibility study that Mary Ellen Egan will talk about as well. Now, there's another option in addition to complying with the FAA order, and that is to petition for review of the FAA's decision to the United States Court of Appeals, either in Washington, D.C., or in the 11th Circuit Court of Appeals in Atlanta. Let me just be very clear on this point. We do not recommend filing an appeal to the final agency action. We've handled many of these over the course of years for airports around the country, and I'll describe very sort of generically the uphill battle. Challenging an FAA decision based upon an FAA record is a very, very difficult prospect. I tell clients frequently that we're very lucky to have a 50-50 chance of winning in the Court of Appeals. And this particular case, given the nature of the FAA's arguments and the nature of the law the FAA decided, we think the chance of success is very substantially less than 50%. In my view, the chance of success is unacceptably low to justify the high costs of appeal. The reason that it is very unlikely to succeed is a principle in law by which the courts will defer to FAA legal interpretations as to the applicability of various federal statutes to this restriction. In other words, we are not given what's called a de novo review. The court does not completely start from scratch and look at the law. The court instead defers to the FAA unless the FAA's interpretation has been arbitrary and capricious. So the chance of success and the cost balance, in our view, in favor of not filing an appeal in the Court of Appeals. Now, there are a couple other factors that are worth considering. Number one is that the decision provides that the FAA will withhold approval for any application for grant funds to which the county is entitled, pending submission of the corrective action plan. The decision does not say that that withholding will be stayed if we decide to appeal. Now, we can seek an appeal, but that's not an automatic thing by any means. In addition, there's possible risk of further FAA action, including withholding grant funding and eligibility to collect passenger facility charges at Palm Beach International, and injunctive relief, and a number of other actions the FAA could take if it believed that the county was not acting in good faith when it chooses to appeal. So it's an important issue for the county to consider in the balancing between appealing or complying with the final agency decision. And let me just make clear that we have fought this over the course of 20-something years. We have been successful. We think we have good arguments, but at the end of the day, the FAA was the decision maker in this, and we think that filing an appeal is not prudent. So let me walk through what the elements are of the corrective action plan. If we can go to the next slide, please. There are both immediate actions and longer-term actions that we are proposing for FAA to approve that the county would take. The FAA has to approve the corrective action plan. Number one, of course, we say the FAA will approve the corrective action plan, and we're assuming that this would take place within about 30 days, say by mid-April. Number two, the county will notify the complainant in the Part 13 litigation that he may operate his aircraft using runway 1028, and that the county will not enforce the jet restriction for other aircraft landing on runway 1028. And let me give a little footnote here to explain why we're talking about one runway. And that is because the FAA has already made a safety determination that use of that runway for jets is safe as a matter of airspace. The FAA has not made any determination as to the other runways, and because the FAA is the ultimate arbiter of safety, we can't give any opinion as to whether aircraft can or cannot use the other runways at Lantana. So number three is that we will submit a request to the FAA that until further notice, all jet aircraft should use the approved runway 1028. Number four, we'll submit a request to the Florida DOT that they remove any notations in their records that restrict jet operations at Lantana and add remarks that jets can use runway 1028. And we would do the same in number five, removing language from the county webpage. We would not enforce the jet restriction against jet users on runway 1028. And finally, we would inform the city of Atlantis that we will no longer be able to continue to enforce the restriction as set forth in the 1991 interlocal. So those are the immediate actions. Those are the actions that if the Board of County Commissioners approves our recommendation to move forward, and if the FAA approves the corrective action plan, these are the 7 actions we would begin implementing immediately in April. We can go to the next slide, please. We then, under the corrective action plan, have 6 months to accomplish the remaining 10 items. Number 8, we would request that the FAA conduct an assessment on the airspace impacts of removing the restriction. This is the issue I mentioned a moment ago about making sure that it is safe, or determine whether it is safe to operate jets on the other 2 runways at Lantana. Number 9, as I mentioned, the county is in the process of doing a noise compatibility study, also known as a Part 150 study. And so the forecast for future operations that are being used for that study would be updated to show jet operations. That forecast must be submitted for FAA review and approval before we can move forward with the study. Number 10, we would conduct and schedule and conduct public meetings to announce and discuss the forecast, which would show how many operations by jets are contemplated. And again, Mary Ellen Egan is going to talk about that in a moment. Number 11, we would develop a noise exposure map to show the effect of jet operations, as well as all other operations in the future at Lantana. And we would have meetings to present and accept public comment on those draft noise exposure maps. They would be submitted to the FAA for review and acceptance as it's required by FAA regulations. Number 14, following all of that, we would present to the Board of County Commissioners a resolution to formally repeal the jet restriction and provide an opportunity for public comment on that repeal. As required by Florida law, number 16, we would post the resolution publicly for 4 weeks before the rescission of the restriction would become effective. And the last 2 items would be to update the formal FAA records on Lantana and the county website, and to complete the Part 150 noise study. Those are a lot of steps to take over the course of the next 6 months, but the principle here is to ensure that the county moves forward deliberately and transparently, and the public is fully aware of what the county is planning to do. With that, Mary Ellen, can I turn it over to you to talk about what the practical, sort of the on-the-ground implications are of the proposal to implement the corrective action plan?
Yes, thanks, Peter. So what are the practical implications of the introduction of jet operations at Lantana? First, and most importantly, the types of jets that could operate at Lantana are significantly limited by the length of the airport's runways. As you can see in the airport layout plan, which is shown on the slide here on the right, the longest runway at Lantana, runway 1028, which runs east-west, is less than 3,500 feet. The other two runways are 3,400 feet and 3,250 feet, respectively. Secondly, the Department of Airports has no current or proposed plans to extend any of the existing runways, meaning that no larger aircraft would be able to operate than are currently would be able to operate. The Department of Airports has completed a draft master plan for the airport and does not show any indication of lengthening either of the runways. Thirdly, Lantana is not a commercial service airport. The Department of Airports does not expect that Lantana will become like PBI or even North County Airport, which is the designated jet reliever airport to PBI and was developed specifically for that purpose. Instead, the Department of Airports expects that users will be itinerant users of the airport. That is, they will not be based at the airport. We have not completed our noise analysis yet, but our preliminary indications are that there will not be a significant change to airport noise exposure around Lantana. And finally, not only do we expect the types of aircraft to be limited by the runway length, but also the number of them, the level of activity. Next slide, please. Our preliminary review indicates that these are the jets that could operate at Atlanta, as I said, based simply on the runway length, which significantly constrains the use of the airport. The complainant's aircraft is the Citation 1. The two aircraft that are shown in the photos are the Citation 525 CJ-12 on the left and the Cirrus Vision on the right. I do want to point out that this list may change. The Department of Airports is having its aviation planning consultant prepare a comprehensive evaluation based on aviation planning guidelines and runway length. Next slide, please. The next two slides present a comparison of noise levels from various aircraft types. This first slide shows single event noise contours for aircraft that currently operate at Lantana, listed by frequency of operation. The metric that we have used here is the sound exposure level, which is a measure of the noisiness of an individual event, as shown here for both the arrival on the left and the departure on the right side of each figure. The scale and graphic at the bottom of the figure shows a notional flight path arriving and then departing. The important part of this graphic, the important takeaway here is not the absolute value of any of the noise levels produced by the aircraft, but the relative noise level. Starting at the top of the figure, we can see that the noise footprint of the Cessna 172, which is the most common aircraft operating at Lantana at about 58% of total operations, is quite small. The next most frequently operating aircraft at the airport is the Beech 36, which is the next figure underneath, which is at about 10% of the operations. And you can see that it's quite a bit louder than the Cessna 172. Next is a helicopter, the Robinson R-22, which is used for training. You can see that it makes more noise on arrival than departure at about 9% of total operations. The other aircraft that are shown on this figure operate much frequently at the airport, but include the Piper Aztec, the twin turboprop Beech 18, the Cessna Caravan, and the Piper Twin Comanche. You can see that of all the aircraft shown on this slide, the noisiest on arrival is the Beech 18, and the noisiest on departure is the Comanche. Both of these operate less than 1% of the time. Next slide, please. This slide presents the same SEL contours for the jet types that could possibly operate at Lantana. Again, these are severely constrained based on the runway length. There are several observations to make about this slide. First, the noise levels range quite a bit, with the Eclipse 500 being the quietest of the aircraft shown here. The noise footprints of the Cessna Citation 2 and CJ2 are very similar, with longer arrival and shorter departure contours, especially as compared with the Citation 1. Again, the Citation 1 is the aircraft that's owned by the complainant. It's also important to note that there are aircraft that currently operate at Lantana that are noisier both on arrival and departure, and in some cases both. That's the Comanche. This is not to say that jets will not be noticeable, as the sound characteristics can be different, but on a purely acoustic level, the jets that would be able to operate are not out of line with existing activity. Next slide, please. To make this comparison as easy as possible, I've taken the noisiest aircraft from each of the previous two slides. The Piper Twin Comanche from the current aircraft that operate, and the Cessna Citation from the possible jets that could operate. You can see that they are about the same on arrival, but the Comanche is much noisier on departure. Next slide, please. So what does this mean for the ongoing Part 150 study? Fortunately, we are in a good position in the study to address this. There are really four main steps that we will need to take. First, working with the Department of Airports Aviation Consultant, we will develop a revised forecast of operations for the airport that includes jet operations. This will be based on our review of the runway length, the types of activity that might happen at Lantana, and the level of activity at nearby airports that might be similar. Next, we will determine which runways the jets could use. As Peter indicated, we will, as part of the corrective action plan, ask FAA for that determination, and then we'll estimate what percentage use of each of the runways jets would use the airports at Lantana. Thirdly, with both the level of activity and the use of the various airports in hand, we would then be in a position to update the future contours that could include jet operations. These would then be included with a noise exposure map submission that we are required to make to the FAA for the Part 150. We, as you know, those of you who've been following Part 150 have been working on this for several months now, and we would simply add the jet activity to the contours that we already have. And then lastly, those of you who have been following the Part 150, we are at the beginning of the noise compatibility planning phase of the project. We will look at all available strategies to minimize noise from all aircraft activities. Now, this would also include jet operations. These strategies can include things like a preferred runway or flight paths designed to minimize overflight over noise-sensitive communities. This portion of the study is one we will want to work very closely with all stakeholders to develop strategies that are feasible and implementable, because there is no point in developing strategies that won't be used. At this point, I would turn it back to Laura.
So as far as the next steps, we have another technical committee and citizens advisory committee on February 24th. We will be having ongoing public meetings and workshops associated with the Part 150 study. As Mary Ellen indicated, jets would be included in that forecast, and we could talk about appropriate abatement measures at that time. We would also be submitting the corrective action plan to the FAA on or before March 14th, 2021, which is the deadline provided for in the final agency decision. And if you have any questions, we would be happy to answer those as well.
All right, we have some public comment, but before we move to public comment, thank you for the presentation. And just so we're clear, what type of direction are you looking from the board today?
We're seeking approval of the corrective action plan required by the Federal Aviation Administration, final agency decision in Foreman versus Palm Beach County, as indicated in the agenda item.
And what about a decision to appeal to the Circuit Court of Appeals or not?
We are not making that recommendation today.
I understand that, but is that a direction that needs to be given by this board, whether to appeal a decision that affects this as either a defendant or a plaintiff in a lawsuit?
I will defer to the county attorney's office as to that answer.
Clearly, that's ultimately your decision to make. This is something that needs to come to this level, and it's here, and we're just stating our recommendation that we do not recommend to appeal, but it is the board's ultimate decision.
And is the county attorney's office position not to appeal to the Circuit Court of Appeals?
Yes, it is.
Is that based off the advice given by outside counsel retained by the board?
Yes, and our own independent review of the limited knowledge that we have in this subject area, but we've been working closely. Annie has been working with Peter for many years, and I've known him for a very long time as well.
And is it fair to say that, Laura, I know that you're not acting as an attorney, but as the director of the department, that your decision to not recommend an appeal to the Court of Appeals is based upon the advice given by the county attorney's office and counsel that's been hired outside?
Yes, and also my own independent knowledge of the matter from working in the county attorney's office for many years.
Okay. It looks like we have one more question. If the board were to approve the corrective action plan presented to it today and move forward with that, is there still an option to take that appeal to the Court of Appeals simultaneously?
I'm going to defer that answer to Peter Kirsch to let him address it.
Mr. Kirsch?
Let me explain the complexity of that. The short of it is maybe, which is probably not a very good answer. There are two components of the corrective action plan. One is the component whereby the county stops enforcing the restriction. The second component is the rescission of the restriction. If the county rescinds the restriction and appeals, and if you win, you've already lost. And the reason being that by rescinding the restriction, that's exactly the issue that's on appeal. And so what you could do is you could do halfway. That is, you could stop enforcing the restriction while appealing, which would not permanently rescind the restriction, but would mitigate, if you will, the potential FAA concerns about it continuing to enforce the restriction. It would not permanently bind you to having rescinded it.
Very good. And could this board issue that directive to not enforce what we believe is a validly enacted resolution or law? Mr. Kirsch?
If that question is posed to me, yes. I mean, what you'd essentially be doing is exercising your discretion to temporarily not enforce the restriction during the pendency of the appeal.
So we can, just to clarify, because I want to make sure that my colleagues who are on this board that haven't dealt with this on a daily basis like I have and on a decade basis as Laura has, understand the import and impact of the decision we're making here today and some of the legal nuances that surround the decisions that we're making today. So it is possible to both do a corrective action plan, and it is also possible to stop enforcing without officially rescinding our ban on jets. Is that correct?
Let me be a little bit more precise than that. You would not be implementing the entire corrective action plan. You would be implementing, in essence, the first half of the corrective action plan. You cannot both implement the full corrective action plan and appeal. So it's really a half and half situation.
Well, I thought the corrective action plan contemplated rescission of the resolution over a period of time, within 180 days.
That's correct. That's why I say the corrective action plan has two steps. One is the non-enforcement over the next 60 days, over the next 30 days, I'm sorry, and then the rescission within 180 days. It's that rescission that you wouldn't want to do while appealing because you'd essentially moot the appeal by doing so.
Well, we also have 180 days, which is about a half of a year, is a long time for these proceedings to play out. So how long do we have to give notice to the FAA that we intend to seek or at least file a notice of appeal?
The notice of appeal must be filed by March 14th, which is the same day that the corrective action plan is due to the FAA.
And if we
Now,
seek
just to be clear, once we file an appeal, that appeal either to the 11th Circuit or the DC Circuit takes today about 2 years or so to get resolved. That's because the courts are a little bit backed up because of the pandemic, but roughly 2 years.
That's just the appellate process, to be fair. I mean, I've argued multiple appellate arguments to appellate courts in the state during the pandemic by Zoom, so it's not as if our judicial system has stopped. At the same time, we have till the 14th to file a notice of appeal. And then at any time we can abandon that intent to file an appeal or do the briefings or abandon the appeal altogether, even if it's been briefed. Is that correct?
That's correct.
Have you interfaced at all with the FAA given the transition that has just occurred in the federal government between President Trump and President Biden?
Yes, considerably, yes.
Have you asked for any leeway or any indication as to whether the Biden administration seeks to be as punitive as the Trump administration, as you've expressed, with regards to enforcement of our, or lack of enforcement of our jet ban, or actually utilizing our appellate rights in this context?
That's actually a difficult question. Let me tell you why. The FAA official who issued this decision is known as the Associate Administrator for Airports. He resigned the day after this decision was issued, and he has not been replaced. There's an acting associate administrator who's a civil servant and not a political appointee. And so it's hard to judge right now whether the new administration's new appointee, who hasn't even been nominated, much less confirmed, whether that new person would take a similarly aggressive view. I think it is fair to say that the recently departed associate administrator took an unusually aggressive posture toward Lantana and the county on this matter. But we also know that this has been a matter that's been litigated over a course of 20 years. So I'd be a little reluctant to make an assumption without knowing who's going to be appointed, making an assumption about whether the new administration will be more lenient. I can tell you, however, that if the county chooses not to enforce the restriction during the pendency of an appeal, the FAA is likely to be less antagonistic toward the county, because practically speaking, what the FAA has been seeking in the corrective action plan will at least temporarily be in effect. That is, the ban will have been lifted during the period of the appeal. So I think the FAA is likely to be somewhat less antagonistic, if you will.
And that, I'm delighted to hear that, because I am an optimist and I am idealistic, and I was so taken aback to hear from you, sir, that the federal government, maybe I wasn't surprised, but that the federal government has the ability to be vindictive towards local governments with regard to the local policy decisions that it makes. And so this is the first time I'm hearing some retreat from that position, in that the new administration may take a different approach to local control and local authority and protection of the health, safety, and welfare of its residents that surround an airport. We don't know that answer, but we do know that every regulatory decision that has come from a regulatory agency in the federal government comes cloaked in a blanket of deference, right, to the Court of Appeals. Fair?
Yes, that's correct.
So, I mean, when I have a lawyer that's a prominent lawyer that's with a prominent firm that's been working on this for 25 years, who says we shouldn't appeal, and the only reason listed in that position is that the court, the regulatory administrative court's decision is cloaked in a deference of correctness when it gets to the Court of Appeal, you can understand my frustration when there's no analysis of the substance of the appeal itself. And I think that as we go down this road and we talk about what the correct answer is to this very important decision, that it merits some interaction with the new administration, that it merits a discussion with the town council of Atlantis and the town manager to talk about perhaps going at this together and sharing some of the costs, or splitting the baby, so to speak, in with regards to not enforcing the jet ban, but at the same time exploring what our true appellate options are. And so I don't want this opportunity to pass, because after 25 years, this is my one day to represent my constituents, to ensure that their appellate rights are protected. And if we don't allow this to move forward today, or at least file a notice of appeal, that right will be terminated forever. And I can't let that go, under the guise of, we probably won't win. Well, if I'm a lawyer, and I want my counsel, if I have a lawyer, to always be as honest and candid with me as possible. But at the same time, every lawyer knows you can't correctly, I don't want to use a betting term, but you don't know what the courts are going to do, particularly courts of appeal, and you don't know what the underlying regulatory agency is going to do, particularly given the fact that the high-level political appointee that made this decision left office the day that he made this order. I mean, I don't want to get into a political debate about Trump versus Biden, but let's be honest about one thing. The Trump administration's never been a real good friend to the Department of Airports in this county in the history of our history as a county. And maybe there was some retribution in that regard. I don't know. I'm not going to say things about a former official that I don't know to be true. But the other thing is, President Biden may have an entirely different policy picture in his head as to how he wants that FAA, his department, to operate. And I think it merits that we slow down, and whether it's this council or another council or in-house council, reach out and speak with the new political appointees at the FAA. I'll leave it at that. Vice Mayor Weinroth, you're recognized, sir.
Thank you. Just to clarify 2 points, please. Can you let me know, if this action is taken, would this enlarge the hazard zone that's within the Lantana Airport area?
No, it will not. Nothing will change at the airport. We have nothing in our plans right now to increase anything at the airport, whether it's pavement strength, runways, anything like that, no lengthening of runways. So the character and the nature of the airport as it is today will remain.
Vice Mayor, what's the hazard zone?
The hazard zone is the
runway protection zone?
Right.
Yes, no, it will not change.
Again, and there would be a restrictive covenant within the deeds that are within the hazard zone, notifying them that they were within that zone, so that when they took a title to the home, they knew that they were within the hazard zone.
If you're speaking of the runway protection zone, there are no homes. I don't believe there are any homes within the runway protection zone right now.
Is the town of Atlantis within the hazard zone or not?
The runway protection zone, there may be some land that's part of that. I don't have the airport layout plan in front of me right now.
But you're saying nothing within what we're discussing today would impact
Nothing
or
would change.
Require that be increased?
That's correct, because we're staying at the same, we're designing the airport to what it is today. That's
The
why we're
runways
saying
are the
it's
same.
limited.
No one's changing the
Correct.
size of the
Exactly.
runways.
Correct.
Okay, so.
Okay, but the operations that would take place with jets versus propellers, that doesn't change the dynamic of the hazard on the ground?
Correct.
Okay. And the second question I had is, you allude to the intergovernmental agreement for Lantana Airport, and you're saying that you're going to inform the city of Atlantis that we're going to be unable to continue to enforce the restrictions. Can you just give me a bird's eye view of what our responsibilities are? Have we made promises? Have we agreed to protect them from certain situations? What would be the ramifications of us taking this action? Should I go to legal, or do you feel that you're...
I mean, I can answer that. The interlocal agreement requires the county to enforce, to the extent of the county's authority, the restrictions, guidelines, and procedures that's set forth in the exhibit on the interlocal agreement, which is relative to the operation of the airport, and it will incorporate them into the master plan of the county airport. And then it goes on to say that if these guideline restrictions and procedures cannot be enforced by the county due to FAA regulations, that the county hereby agrees to take reasonable steps to attempt to make these guidelines and restrictions mandatory. So it's our position that the county has already taken its reasonable steps in order to enforce these restrictions, and we can no longer do so because of the FAA's recommendations and regulations.
So it's your reading of this document that it does not put on the county a responsibility to continue in an appeal if council deems it that it just doesn't make sense to go further?
Correct. It's our recommendation that it's not a violation of this interlocal agreement because we've already taken the reasonable steps required under the interlocal agreement.
Thank you. Thank you, Mayor.
Thank you. We'll move now into public comment, and we'll start with Vice Mayor Alan Kolbach. You'll have 3 minutes, sir, if you want to use this microphone, and then we'll go to Jonathan Miller at this microphone to my left and your right.
Yes,
Vice Mayor, you're recognized, sir.
Thank you, Mayor. Good morning. My name is Alan Kolbach. I'm Vice Mayor of the City of Atlantis and the Council's designated representative on Lantana Airport issues. I want to thank you for the opportunity to be here, and I'd like to build on the Mayor's comments. You are being asked to approve a corrective action plan to address the FAA's decision requiring removal of the county's jet ban at Lantana. Before acting on the department's recommendation, the county commissioner should consider significant issues. First, the FAA decision is primarily based on its own internal findings, affirmed by the deputy administrator who left the day after he issued the decision. Second, the facts in this case strongly merit independent judicial review of whether the FAA's findings and conclusions are correct before the FAA is allowed to mandate a drastic policy change in longstanding county aviation policy. Third, based on conversations with our aviation counsel, also based in Washington, who has considerable experience, independent judicial review could result in a finding that the jet ban is reasonable, non-discriminatory, and grandfathered under ANCA, contrary to the FAA's findings. Why do I say this? First, the county has openly and continually maintained and enforced the jet ban before and after the repromulgation in 1988. Second, the county's jet ban restriction has been upheld in writing by the FAA's local office on numerous occasions until the 2016 challenge. Finally, the county's Lantana Airport master plans after 1988 were reviewed by the FAA, presumably in Washington, as a basis for ongoing grant funding. Those plans clearly stated the existence of the jet ban restriction at Lantana Airport and the airport's position as part of the county's system of airports. Let me emphasize that this is not just about noise. The FAA's imposition of a 60-day time limit for development of a corrective action plan and its open threat to withhold federal grant funds not only for Lantana, but the county's other airports is rushed, premature, punitive, and arbitrary for several reasons. First, there has been no publicly detailed safety assessment of introducing jets at Lantana Airport, which is surrounded by residential communities and a hospital. Second, there has been no operational analysis of the potential risks and consequences of introducing jets at a facility where there are 4 flight schools for fixed-wing aircraft and helicopters in addition to general aviation traffic. Third, the FAA is attempting to bully the county into reversing a 40-year policy upon which it and its constituents have relied based on one single complaint filed in 2016, no judicial review, and unlike other cases cited by the FAA in its decision, the county has ready access to airports nearby. In closing, I would respectfully urge the Commission to appeal the FAA decision pursuant to its contractual obligations to Atlantis under the 1991 interlocal agreement. Parenthetically, we do believe there's an obligation to us. We would also suggest a stay in the development of the corrective action plan pending appeal. We would also suggest that the plan be premised on a detailed safety assessment of the introduction of jets at Lantana, and that there be a specified opportunity for public review and comment on the safety assessment and the proposed corrective action plan. We also think the state's congressional delegation should be alerted to the circumstances surrounding the FAA's decision and its heavy-handed tactics. Brian Morey, our city manager, and I are here. We're happy to answer any questions. You've received innumerable comments, I think, from our residents. There are a group of residents here with me today. And I thank you very much for this opportunity. Be happy to answer any questions.
Thank you, Vice Mayor, and I appreciate both you and the city manager hanging out in case there are any other questions or follow-ups from members of the board. Mr. Miller, you're recognized, sir, for 3 minutes.
Thank you for giving me the opportunity to speak. I am Jonathan Miller, one of the owners of Stellar Aviation at the Lantana Airport. We're the fixed-based operator, operating under a long-term agreement with the county for the past 5 years. And we don't operate any aircraft, but we provide the services, hangar, tie down, and fuel services there at the airport. A couple of things that concern me as to the future operations at the airport is, first, I'd like to state that we as the operator concur with the consultants and your council that the likely number of operations, even if the jet ban was rescinded, the likely operations are minimal. And we don't believe it's going to have a significant impact like the analysis showed that current aircraft operating at the airport are louder than any of the jets that would even consider coming in there. The jets that are going to come in there are not 135 operations, they're not charter aircraft, they're not fractional aircraft, they're small aircraft, owner-operated pretty much. They're not owned by large corporations. So you have owner-operators operating it for their convenience. Maybe they have a house down here, whatever it is. So it's not going to be like opening it up to NetJets or FlexJet or some of these large charter operators that you get at Palm Beach International or F-45. So that's the first basis of my observations. The second is regarding what I hear today about the FAA and the administrator's retirement after rendering this, what I read was a pretty scathing opinion about, you know, his findings. Those findings were based on findings at the staff level. They were not his findings. They were findings that came up through Deandra Brooks, as I understand it, a staff member of the FAA, to another administrator, finally to this guy after the appeals of the county. So it's not like this guy just made his determination. His determination was based on like a lot of what you consider is your staff's recommendations. So I wouldn't want to, you know, stake a claim on that, but again, I leave that to the board's discretion. Furthermore, the thing that concerns me the most is the federal funding. You know, there's a lot of improvements that we have made at Lantana as the operator. There's a lot of improvements that the county has made at Lantana, which we're grateful for, but those rely significantly on federal funding. I'm sure at F-45, I'm sure at PBIA, that is the same, you know, if not 10 times more. So it really concerns me is not only at my airport, but the overall airports is by taking this, you know, half measure approach of, you know, rescinding the ban, but also appealing, you know, how is the FAA going to look at that? And how is that going to affect their threats to withhold federal funding? So it concerns me as the future development of some of the safety improvements we're making at Lantana, that federal funding could get cut off because of what we decide to do here today. So those are just my observations. I mean, I do believe the impacts we're talking about are minimal. We're obviously a tenant in good standing and intend to remain that way. So whatever the board decides, you know, we'll try to find a way to reasonably accommodate those decisions. Okay, but we stand willing participants in the Part 150 study that's underway right now. That is a tried and true method of dealing with these issues. These issues are not just Lantana's issues, they're all over the country. We dealt with these issues at Boca Raton Airport as a Galaxy Aviation. We dealt with them as Galaxy Aviation at the Stewart Airport in Stewart, Florida, all of which conducted the Part 150 studies, got very boisterous community members together who were impacted, along with the FAA or the 150 participants, the airport, and the operator. And we all came up with reasonable, you know, operational restrictions that were voluntary, but everybody supported. And in the end, that's the best process for what we're doing here today, what we're trying to do here today, is to come up with, even if jets are allowed, how do we maintain, you know, our right as an airport to operate and the citizens' rights to quietly enjoy their property. We agree with both of those. I happen to agree more with one because I'm not a homeowner in Atlantis, but I certainly understand their concerns. So we stand by willing participants in the Part 150 study and will support whatever the board decides to do, obviously.
Thank you, and I have no doubts that, is it still Stellar? Is that the name of the?
Yes.
I have no doubts that you, as the leader of Stellar, and Stellar itself, will continue to be great partners in the navigation of this issue, but also great partners at the county. You guys run a heck of an airport. Aaron does a heck of a job, and regardless of where the board goes, I know you'll be a great agent on behalf of the county in running that airport. So thank you for your comments here today.
Thank you, appreciate that.
I think everything else is non-speaking. I'll double check. I wanted to just touch, oh, here we go. Carlos Serrano. I think, okay, these are forms that were submitted online, so they're not actually going to be here, correct? All right. I wanted to ask you a question. So are you a pilot?
I am not.
Are you a pilot? When you responded that there would be no increased hazards at at the airport if jets were introduced into the flight pattern and operations of the airport. Talk to me how you reconcile that opinion.
We are not doing.
Hold
no,
on.
Sorry.
Talk to me how you reconcile that opinion, understanding that Robinson 22s are primary flight training helicopter, Cessna 172s and the like are primary flight training single-engine aircraft. Both operate at 60 knots, sometimes less, particularly helicopters, and then introducing jets that in the pattern can go 150, 160 knots. Tell me how that intertwines with your finding of no increased hazard in that area.
In that regard, that I believe, and I'll relay that or ask Peter to respond to that as well. I believe the FAA, in their safety assessment that we will ask for as part of the corrective action plan, that operational impacts will be looked at during that safety assessment. My response to Vice Mayor Weinroth was in regards to how we design the airfield. We are not doing anything now or in the future. We have no plans to enhance anything at the airport to entice jet aviation or jet aircraft into the
Neither
facility.
do we as the policymakers, by the way, best I can tell, because that would be our decision.
Well, we're not doing anything to change the nature of the airport. It is what it is today. We don't have any plans, like I said, to change the runway lengths, redesign or reconfigure any of the runways, which means that we're building it to, and if you're familiar with the standards, most of the design standards are based on the wingspan of aircraft and the approach speeds. So we are at a B2 right now. So the aircraft that are operating there fall in that B2 category. We're not changing it, much like we are at North County Airport, where we do have a runway expansion.
Expansion and controlled airspace and a tower coming.
Correct.
Okay, so
hopefully.
you don't quarrel with the fact that I think it's dangerous for me to have to take off at 60 knots, where rotation speeds for jets are 130, 140, share the pattern with them in an uncontrolled airspace with Class E airspace 7 miles to the north, Class G, E, D airspace 10 miles to the south, and a soon-to-be controlled airport jet reliever in North County. You can see how I'm telling you that it's a hazard from a pilot operation standpoint.
And if I can just jump in there, we do not determine safety of airspace. That is the FAA's decision. They're the sole arbiter of that. In the final agency action decision that was addressed, the administrator indicated that he did believe that that there may need to be some additional procedures that are adopted for that airport, but that's something that would be determined by the FAA, not the airport.
Yeah, well, hold on a second, because the health, safety, and welfare of my residents and my constituents and the people that fly airplanes and the people that own homes below that airplane that's coming into land or taking off, we protect their health, safety, and welfare. So when you ask me to abandon an appeal that involves the exposure of public safety issue, I kind of have a problem with that.
Well,
Because
maybe Peter can address the difference between what the county's role
respectfully, I don't need Peter to tell me that it's dangerous to have a jet aircraft, or not dangerous to have a jet aircraft and a Piper Warrior in the same pattern. I don't need him to tell me that. And I'd be offended if he told me, well, the FAA says it's safe, so we should take comfort in that. I've had to share the pattern with jets before in uncontrolled airspace, and it's not a fun thing to do. And it's certainly not safe. So I don't need counsel to school me on that issue. We're going to go to comments by the board. Vice Mayor Weinroth, you're recognized.
Thank you, Mayor. And I just wanted to clarify, while I'm not a pilot, I had been a member on the board of BCT, so we had addressed this at point with especially the Lanson property, which is going to be developed as far as the hazard zone there, and addressing how that was going to affect the residential character of what's going to be redeveloped there. But, you know, I was less concerned with the infrastructure at the airport and more with the operations that would occur now that you were allowing jets. And I'm a little bit fuzzy after the conversation you just had with the mayor. Is it your representation that there will be no change to the hazard zone, or is it yours that you are going to defer to the FAA to make that decision at a point in time if there are, again, jet operations in and out of that airport?
On the ground, we are not making any changes to the hazard zone, and the FAA's safety study that they will undertake as part of the corrective action plan will address that.
So
we'll
you're
address
saying,
the operational issues.
So again, to clarify, you're saying that there is a potential that the FAA could reevaluate the zone around the airport to determine at what area would be classified as a hazard zone, and that could be changed because of the operation of jets in and out.
I think we're talking about two different things. The RPZ is really a dimensional standard, and that because the runways aren't changing, that standard isn't changing. The other issue is airspace, and airspace really is within the purview of the FAA, which is why one of the things that we're asking as part of the corrective action plan is for the FAA to go through a safety assessment to determine whether it's safe from an operational standpoint to operate at that airport.
At BCT, we had installed passive emergency stops at either end of the runway because they're constrained. Are we going to do the same thing in Lantana with the jets going in there and their potential need for additional runway in an emergency?
We do not have plans for that as of this date. We have a similar system on the ends of one of the on the end of the Crossway runway at PBI, but we have no plans to install the EMAS, is what I believe you're talking about, at Lantana Airport.
Is this something that we need to be studying if we're going to, again, have operations of jet aircraft in there and the potential for them overrunning the runway? You're saying they're constrained. What's at either end of the east-west runway?
I'll answer that. It's Congress Avenue and a lake.
So
after that is Atlantis, and there's homes right there.
If I hear the mayor correctly, it would appear that we have a situation where if a plane overruns that runway, they're either going to wind up on Congress or in the lake. If we are going to go forward with this particular decision, is there a follow-up thought about having additional, and again, EMAX or some other system to protect both people on the ground and people who are operating from running off the runway and finding themselves submerged or in the middle of Congress?
So we're also in the middle of our master planning for that airport as well. It has not been adopted. It did not consider jets because they were not permitted at the airport. We would have to reevaluate whether any improvements are necessary because of that. But it wasn't contemplated in the original draft of the master plan.
All right. Well, and again, it's sort of a side note in this, but I would recommend maybe you reach out to Clara Bennett down in Boca to identify the issues that Boca Raton dealt with, because obviously it's a major investment to put those systems in. And if it's necessary, if we're going to have, again, a need for this based upon the jet operations, I think we need to be making those plans now. Thank you.
Thank you, Vice Mayor. And just to give you some context between the difference between runway 1028, which has been authorized by the FAA for jet use as safe, versus Boca Raton's Airport Authority runway. Lantana is about 3,400 feet. Is it less than that?
Just under 3,500.
Okay. So Boca is over a mile long at 6,200 feet. Okay. Controlled airspace at Lantana? No. Controlled airspace at Boca? Yes. Class D. Airport Air Traffic Control Center and Tower at Boca? None at Lantana. So what will happen is, if we roll on this, is the FAA is going to say, oh, you know what, it's not safe. You guys need to have a tower. You need to have controlled airspace. That's precisely the character and nature concerns that I have. And I agree with you, Mr. Miller. There's not going to be a lot of jet traffic right away. But once if I roll over on this and jet traffic's allowed, the FAA is going to come and say, you got to have a tower and you got to have controlled airspace. And that's not what my residents moved into this friendly general aviation airport for. Commissioner Weiss and then Commissioner McKinley.
Thank you. I share, as somebody, I also have a private pilot's license, and I share your concern about mixing this kind of traffic together in uncontrolled airspace. I mean, I don't know how in anybody's right mind you can put a jet into final approach with a Cessna ahead of it. I mean, that's just a recipe for issues because, I mean, he's going to surpass them in final approach quickly.
Well, and these are all issues that need to be addressed from the FAA from their safety assessment. This isn't, what happens in the air is not something determined by the Board of County Commissioners. It's determined by the Federal Aviation Administration. They have the sole regulatory purview over airspace. That's not a decision that we make, and that is what they do every day. And as far as uncontrolled airports versus controlled airports, there is a mixture of aircraft at many general aviation airports without control towers. I mean, F-45 has a mixture of aircraft as well. Now,
They're moving to a tower in controlled airspace, Laura.
And there are significant helicopter operations at that airport, and that does, obviously that's an issue as well.
Well, I just think, I mean, it seems to me like to not be, to say, yeah, I understand that they're the ones who regulate this, but to not say that it's not a potential problem. And unfortunately, it's not only the people up in the air that this impacts, but if they screw up, it's going to impact the people on the ground as well. And it's to say, okay, to just, I can understand where the mayor's coming from and wanting to try and find, I'd still be concerned if we were to allow, what has been said, that we allow operations to happen while at the same time trying to appeal it. It does seem like it makes sense, but we've still got a safety issue potentially as well, regardless.
I think those are issues that we've raised with the FAA in the past with regard to the various complaints. They did indicate that they did an assessment of runway 1028. The corrective action plan, we're asking them to also do a safety assessment of the other runways as well. And that really has to do with airspace. It doesn't have to do with the infrastructure on the ground.
Right. Which way, where they're going to end up. I don't know. I think this is, when it first came in front of me, I was sort of surprised because, of course, I learned to fly on the West Coast, and it's different out there than it is here. With this particular airport, I hadn't seen anything like this before. But it seems like we have an opportunity, maybe to, if you will, to share in this with the folks over in Lantana, as well as, capitulate, if you will, to the FAA in releasing the ban or not enforcing the ban, while at the same time pursuing every legal option that we have available to us.
Thank you, Commissioner Weiss, for those comments. Commissioner McKinley, you're recognized.
Thank you. Laura, well, first let me preface, I'm not a pilot. I did not sleep at Holiday Inn last night, and I do miss Commissioner Valashay when we're talking about planes. But Laura, how much money are we talking about being held in abeyance until this is resolved?
I believe currently we're talking about the general aviation entitlements that are suspended. That's about $450,000 a year. The cost of litigation is about $150,000. If the FAA proceeded under ANCA, that jeopardizes also grant funding for PBI. I believe also the discretionary grant funding for PBI was suspended as well. We don't have any pending applications for discretionary grants, so that's kind of a non-issue as far as PBI right now. If the FAA did proceed under ANCA, that would jeopardize potentially our passenger facility funds, which is a much larger number. Gary could probably let you know.
Before COVID, I think for passenger facility charge funds, we were collecting roughly $1.2 million a month based on our plans.
Just so we're clear, because Commissioner McKinley's asking what's at jeopardy and what's at stake, are you saying that if we go and use our appellate rights, they're gonna automatically take these funds away from us? Is that what
No,
you're saying?
there's absolutely a process that they would need to go through. Obviously, we would seek a stay to try to prevent them from doing that. And as Peter indicated, non-enforcement of the jet ban would probably mitigate the worst impacts of that. Now, the one thing I caution you about non-enforcement, that means the jets would start operating at the airport, and we would also still ask the FAA to go through those assessments, but it wouldn't be included as part of a corrective action plan. And if we are ultimately unsuccessful, we've not really gained very much.
Well,
if we're not enforcing
there's some honor in fighting for public safety. So if we lose and we didn't gain much, well, I disagree. Commissioner McLean, I'm sorry to interrupt.
That's okay, Pilot Kerner. So I'm just confused. So right now, what the FAA has said is if you appeal our decision, we will withhold about $450,000 or up to.
So today, under the federal agency decision, they immediately suspended our general aviation entitlement grants, which is about $450,000.
And that's across all of our airports.
That's across the general aviation airports. They reserve the right to consider proceeding under another law, which the consequence of that is much worse. However, you know, there are opportunities to attempt to try to mitigate that, but non-enforcement is the most obvious because we preclude them, is my understanding, and I'll have to defer to Peter on that, from actually proceeding under ANCA.
So they actually have a law in federal code that says to a local government, if you appeal one of our decisions, we can keep your money.
The federal agency decision says that.
Wow. Well, I don't know, Commissioner or Mayor Kerner, I have the great honor of you know, representing the Association of Counties, both at the state level and on the board of directors and the national level. And the reason both of those organizations exist is to protect home rule. And I'm a little disgusted that another government agency and several, I mean, we're facing threats at the state, in the state legislature right now. If we decide to take action on what's best for our community, they'll withhold funding. And I wouldn't be surprised if we decide to not erect signs on US 27 that we see some sort of punitive action on that ridiculous measure as well. But I feel that you need to make a decision on what's in the best interest of your constituents, and having, you know, some bureaucrat in a federal agency threaten us by withholding federal funds. I have a problem with that, just on principle, just on the right to protect home rule. So I'm not sure which way you'd like to see a motion going, but you've got my support.
Thank you, Commissioner McKinley. Commissioner Sachs, you're recognized.
Thank you very much, Mayor. I want to clarify something. When you said that $450,000 would not be awarded to general aviation in Palm Beach County, when you say general aviation, are you referring to small airports, or are you referring to Palm Beach International?
I'm talking about our three smaller airports, Lantana, Pahokee, and North County.
Okay, so the three smaller airports, not Boca Airport, not the Palm Beach International Airport, but these three smaller ones. And that is contingent. They may or may not, depending on who it is there at the FAA is making the decision. Is that correct?
The federal agency decision said that those are suspended pending submission of the corrective action plan.
Pending commission of what?
Submission of the corrective action plan that we are recommending.
Okay.
It also said that the FAA would consider further action under the Airport Noise and Capacity Act. The Airport Noise and Capacity Act would provide an opportunity for the suspension of all grant funding, including PBI. If we do not enforce, it's my understanding, if we do not enforce the jet ban pendency of the appeal, we may be able to mitigate the worst impacts. So that is an option. However, it doesn't necessarily address some of the issues that you've raised today.
All right. So we have a decision to make. The decision is whether or not we're going to stand up to what the people want in that area. And this, I believe, is Mayor Kerner's area, who are represented here today. Or are we going to succumb to a decision by a federal agency? Is that basically, knowing, of course, the repercussions that could come, as any lawyer would know, whether we could lose or whether we would win? Is that basically what you're coming to us to ask us?
We're essentially recommending, based on the FAA order, to submit the corrective action plan based on the advice of our legal counsel that we are likely to lose on appeal.
Likely to lose. Have we ever filed an appeal against a federal agency before, to your knowledge? man, and you may
Or-
not know. I mean, has this ever occurred before in general aviation where we
As
have
far as
filed an appeal against
The airports?
decision of the FAA?
I don't think so.
I'm not aware of anything. I mean, we
Good.
do a lot of cases in federal court, but against administrative agencies, I'm aware of none.
However, Peter Kirsch has filed many appeals and many actions with the Federal Aviation Administration. So
Has your agency or your group connected with anybody in our congressional delegation or our senators, 2 U.S. senators, who may use our general aviation airports to consult with them in terms of what their opinion would be on this?
no, we have not.
Would that be something that you would consider?
It would not alleviate our obligation to either file an appeal or to submit the corrective action plan. That may be a longer-term solution, but we have an immediate problem. We have to either submit the corrective action plan or we have to appeal. Those are our two options. There may be other longer-term solutions, but we have an immediate problem.
Okay. And the timeline for making that decision?
We must do that by March 14th.
All right. Well, I believe that our mayor is an attorney.
I believe so too, but sometimes
and,
I wonder.
and is a pilot,
In a general sense, yes.
right?
Very general sense.
And I believe that, and I guess I'm asking you, Mayor, most of the constituents, residents in this area would favor an appeal.
I
or at
think they
least-
all would. And I'll preface it by saying I also soloed my first aircraft on that runway that they're talking about when I was 16. And I'm advocating just as much for those pilots that are at risk with jet traffic in the pattern as I am for whether they can vote for me or not, along with the residents that surround the Lantana Airport.
Well, based on all of these consequences, and I would certainly support it, an appeal. And I'm an attorney, and I think that if there's a likelihood of an appeal and the people want it, and there's a strike for home rule, I think that it's time for us to stand up and tell this federal agency that maybe they are incorrect, or after we file the appeal, maybe we can have time to negotiate, or at least to connect with our congressional delegation up there, which also represent us, especially since it's a federal agency. We're a county, and I think that I would certainly favor an appeal. Thank you for your...
Let the record show that I've taken on the responsibility as chair temporarily. I'm going to recognize Commissioner Bernard. No? Okay. Then, Mayor, you are recognized for a motion.
Thank you, Vice Mayor. I make this motion with being totally cognizant of the advice that council has given to us as a Board of County Commissioners, along with the airport director. But I have a problem with rolling over on this, and so I'm going to make a motion. And let me also thank Commissioner McKinley for her reference to home rule and the way that the federal government tries to run over our local governments and our local constituents. And then, of course, let me thank the entire board for the concern for my personal public safety as we attempt to navigate, no pun intended, the difficult road ahead, both in the air and on the ground. I've had some frightening experiences without jets at Lantana Airport. I shudder to think what would happen when we introduce those fast-moving machines into our uncontrolled airspace without a tower. So having said that, it's been my understanding that we can, I'll make a motion to submit a corrective action plan to the federal government and the FAA, but amend it as such that so that we allow us to file a notice of appeal. And I'm going to ask that outside counsel, maybe we don't want to get too deep into this, but the outside counsel protect our appellate rights by filing that notice of appeal, but also consider having a different law firm handle the appeal, given some of the comments that have been made that there's really just no hope for this appeal to be successful, whereas I've heard from the city of Atlantis, who had outside counsel, that perhaps their counsel we'll take a different approach at this. I think I need to be able to be given the ability to speak with Ms. Beebe personally about this after this motion is passed, and then bring something back to the board about how we would really like to proceed on some of the detailed issues. So the motion is to submit a corrective action plan to stop enforcing our lawfully passed ban on jets at Lantana Airport for the time being, to comply with the corrective action plan, to file a notice of appeal, which does not commit us to appealing this, but just protects our appellate rights, and then also selection of counsel to litigate that appeal after we've spoken with the City of Atlantis to see how they may want to help. And then finally, I think there was one more point I needed to cover. So we covered the corrective action plan. Oh, and then also direct our Legislative Affairs Director and Todd to start working with our local delegation. Given the transition in leadership, I think it's important that we as a local government, much like FAC would do, much like any other organization that advocates for home rule, I think it's important that we have a personal conversation with our delegation and possibly even off the record conversations with the FAA on behalf of this county to see if we can resolve this in another way. These items, ultimately this issue will need to be brought back to the board at some level, but as a threshold issue, this is where I'd like to see us go. That's my motion.
Do I have a second? I have a second by Commissioner Bernard. Just to clarify then, you're looking to stop the enforcement of the ban, that you're going to look to the drafting of a CAP, that we file a notice of appeal, that we reach out to our federal delegation for assistance in regard to this, and to determine whether there's an opportunity to, again, obviate what had been done by the last administration. Do I have that pretty well summarized? And seek an alternate counsel to represent us.
Seek counsel to represent us in this appeal. It could be the same counsel. I'm not trying to disparage his work. He's done a heck of a job for us for 25 years. But if he thinks that he doesn't want to take this on, then we will have to seek other counsel.
All right, so we will evaluate our counsel as far as going forward. All right, so I have a motion by Mayor Kerner. I have a second by Commissioner Bernard. Seeing no further conversation, all in favor, aye.
Aye.
Against, opposed? All right, it passes 7-0.
Very good.
I will give you back your gavel, Mayor.
Thank you very much to the members of the board for supporting me on this important issue, to the members of the community council, and to the Department of Airports. I look forward to working with you further on this issue. All right, we'll move back to the regular agenda. Ms. Neiman, you're recognized. Oh, yeah, airports, come back, sorry. We're going to take up, unless the board wants to overrule. Is there a motion to reorder?
Mr. Mayor, I make a motion to reorder the agenda to take up the issue of the Airport Medical Testing Center.
62.
Whatever that number might be.
Motion made by Vice Mayor, seconded by Commissioner Marino. All in favor, all opposed. We've reordered the agenda as such. We'll now take 6D2.
Mr. Mayor, just in case Peter Kirsch is still online, I really feel compelled to say that he is an excellent attorney. He knows what he's doing. We always welcome other input if there's an attorney with Atlantis, but we don't shy away from fights. I mean, we go out there and we don't back down. So I just wanted to publicly make that statement, that what you heard is something that made sense to say publicly, because of course we don't want to lay all of our cards out to say this is why we're going to lose. It would just be inappropriate to do that. There are reasons, but I heard what Atlantis said. I appreciate that. We definitely want to hear what else is out there and work with them if possible. But I really wanted to say something on behalf of Mr. Kirsch, who has provided us excellent service for a long time. And there's no doubt that he will embrace this and run with it. It's just his obligation to let you know that this just doesn't appear to be one of those cases that I can send one of those emails that I love to send to you all. So I just needed to say that. Thank you for the floor.
I definitely appreciate the comments, and I appreciate the diligence of Mr. Kirsch and his law firm. And certainly today, we don't back down from a fight. I think we proved that as well with a 7-0 vote. So thank you to the county attorney's office and to Mr. Kirsch. And I hope to look forward to working with him in the future. You're recognized, Ms. Beebe.
So we're seeking approval of an airport medical testing center with Helix Virtual, providing for the lease of approximately 851 square feet of space at the Palm Beach International Airport for COVID-19 testing to airport passengers and employees and limited medical services to the general public. The agreement would commence upon board approval and terminate on September 30th, 2021 with 3 one-year renewals, and providing for the payment of $27,844.96 for the initial term to the Palm Beach International Airport. This is a service that more airports throughout the United States are providing. It's currently provided at the Fort Lauderdale International Airport and the Tampa International Airport, as well as other airports throughout the United States. We are receiving fairly frequent calls from passengers requesting the service. It's purely voluntary. It's purely being provided as a passenger convenience. Nobody would be mandated to actually take any sort of testing. It's literally just being provided for the convenience of the passengers. It's my understanding that Helix intends to try to open by February 15th if possible, so we may have this service pretty quickly. There are also representatives here today with Helix if the board has any additional specific questions about the services that they would be providing.
Okay. Commissioner McKinley, you're recognized.
Yeah, just one question. Is this for departing passengers or arriving or both?
It would be both within 72 hours of a flight. There are other locations where you are required to, or you can provide a test within 72 hours your departing flight to your next destination. And then the CDC also recommends testing, upon arrival within a period of time. So it's available to arriving, departing passengers within 72 hours.
Okay, and would the provider be billing their insurance or charging for like a concierge fee?
They would be charging their insurance, or the person can self-pay. And if they self-pay, the maximum cost of the test would be $125.
Okay, thank you.
Ms. Beebe, just to clarify a conversation we had offline, if one of these passengers is determined to have COVID, what would be the responsibility of the testing facility with respect to the carrier they're going to be using?
It's the same as every off-site testing center. Currently, our passengers are using those every day. The testing center would be required to notify the health department, but the passenger also has an obligation to notify the airline. They're required to answer specific questions prior to boarding. And as far as rapid testing, it's my understanding that anybody who is taking a rapid test will be asked to stay for the full 30-minute period at that location until the test result comes out.
So, again, just to clarify, you're saying that the passenger would be responsible to notify the airline, but I guess because of HIPAA, we would not have the ability, or this testing facility would not have the ability to communicate that positive result to the airline.
That's true.
Okay. And this would just be a service available to passengers, that if someone else came along with the passenger, they would not be able to avail themselves of this?
It would only be available to airport passengers and to airport employees such as airlines, service providers, any of the agencies operating in the airport, under the theory that we're only inviting people to the airport to be tested that have a reason to be there anyway.
And the location this would be before security?
Yes, pre-security on the second level near Concourse C.
Very good. Okay. Commissioner Bernard, you're recognized.
Thank you, Mr. Vice Mayor. Can we get a presentation by Helix, if you don't mind?
Sure. Chad?
Everyone, can you hear me? Sorry. It's my first game, so I apologize if I bounce around or whatever it may be. So I wasn't expecting to be called up, but I think I've got a pretty good handle on it for the most part. We have, just since COVID hit, it was kind of forced us, as many other medical facilities, to go to a more virtual presence through a telehealth platform. From there, that's actually created a model for us that's allowed us to be able to do mass on-site testing and provide other services that are minor emergent, things that don't require a physician being present. And so what we did was brought that model to this. The RFQ was really just slated for COVID testing. We just took it a step further and presented a project that allowed us to offer more options than just COVID testing. So in doing so, part of the plan that we have, we've tried to come up with as many scenarios as we possibly can to be able to test pre-arrival, post-arrival, departure, and so forth. Basically, the way it's set up is we will have, within the facility, we will have kiosks set up that are all telehealth kiosks. Everything will be by appointment only. We do have the capability to take walk-ins. We obviously want to limit that based on social distancing guidelines and things of that nature. But we understand there's going to be immediate needs at times for people that are going to need to be tested for whatever it may be. So the way it works is they would schedule, we've created QR codes, a real easy scan on your phone. They book an appointment within minutes. We have them on the phone with a provider or a video conference, which is a basic telehealth. That then in turn, the provider will put in the order for the test, which gives us the authorization to be able to test the patient. Insurance requires us to do that. With regards to the PCR testing, now we have a strategic partnership that we've set up with a lab by the name of PHR. It's within about 7 to 9 minutes from the airport. We're going to have 2 to 3 couriers routes a day that are going to be taking the swabs or the samples back and forth, making sure that we can get them tested. We run about 3 to 4 plates a day, so they should make every plate. That's one of the bigger competitive advantages. We don't necessarily have to run a rapid just based on how quickly we can get the PCR high complexity testing turned around for the patients. Other than that, we have rapid options through BD, which is through an analyzer. It takes about 15 minutes to get the result, and then we also have another rapid option that takes a little less, that doesn't require an analyzer. So we have several options. We've also set it up to where a passenger can have their telehealth visit prior to arriving at the airport. We have what's called Helix at Home, which is a kit we can ship to your house. It's self-swabbing, also goes to the high complexity lab through the same testing method. They can either bring it with them on the flight or they can have it shipped to their house, ship it back to us. We do pay for return shipping overnight. I think that's the gist of our testing methods. Of course, we thought about antibody. We do have that. It doesn't seem to be the most sought after method at the moment, but we do have that option as well. And then, of course, given the plan that we have together, or that we've put together, it also allows us to do certain types of occupational medicine for the airlines and things like drug screens, physicals, certain services like that. For the standard passenger, prescription refills, deal with nausea, the typical travel emergencies that you might have that that are somewhat minor in nature. Plan to be there Monday through Friday, 9 to 5, just watching it trend out, making sure we understand when the needs are at the highest, and then from there we'll flex that model to whatever we need to in order to accommodate the passengers and travel.
Thank you very much.
All right, Commissioner Sacks and Commissioner McKinley.
Thank you very much. You could just stay right there if you could. Let me see. Okay, good. The sounds like a little bit of a promo, and it seems like your company also is available to certain PODs to administer vaccinations as well.
We can administer vaccinations. We are not currently administering the vaccine just based on the availability. We haven't even gone down that road yet based on, again, the way it's being distributed. But we can administer vaccines.
And let me understand something. You give a test at the airport. Then the test itself is transported to a site off the premises of the airport, where it is then examined, and then that site off the premises of the airport, that conclusion is then sent to your company, and then you give that conclusion or that test result to the recipient, to the person who was tested.
That is correct. They're set up through a patient portal.
And is this done by a transfer, like an Uber or something, where it's just, driven to a site outside the airport?
It's done through a courier service. Most labs that you have their own courier services that go by clinics to pick up samples several times a day to make sure they make it to the lab. So that would be that.
And how much does it cost the person to be tested by your company?
$125 if they want to pay cash and not bill insurance. At the moment, insurance seems to be covering most testing. So right now we've had zero cost share on most of our patients. I know that every day the insurance is changing a little bit, so there may be a copay associated with it at worst at the moment.
So if a person does not have insurance, then the cost is $125 cash.
Yes, ma'am.
And if they do have insurance, you take the insurance information, and then whatever the copay is the person does will pay. Is the, and you're using the premises of the airport, using our lounge, I believe, at the airport.
It was formerly a lounge.
A lounge, right. And are we, and thank you very much, but don't go away, there may be more
You got it, I'll
questions,
stay
all
right
right?
here.
Are there, do we get, and again, I probably could research this myself, but I'm just wondering, does the county get a portion of the monies that are
Not for the COVID.
expended? I mean, is there a lease agreement to use our airport?
This is a lease agreement, and it provides for the payment of rental to the county for use of that space based on the standard terminal rental rate. We went through a competitive process. They were the successful proposer for the lease of the property. There were certain required services, and the minimum required services was the provision of COVID-19 testing.
Okay, so
But
Helix.
we don't
would-
share in any of the fees.
Of the money
themselves.
that comes in for the testing
Right,
itself?
but we do receive rental.
Okay, so it's a lease agreement with the county airport, so we get the monies from the lease. It's not dependent on how many tests or anything like that. And then one other question I think that Vice Mayor brought up. It's an interesting question, but if somebody is tested positive and they're about to go on a flight, does the public have any recourse, the other passengers or the airline itself have any opportunity to know that there is somebody on that flight who is tested positive for COVID? Or is this only up to the passenger to tell the flight and then not take the flight?
So what happens currently, it's my understanding with COVID testing, that those results reported to the health department. They are not reported directly to the airlines because of privacy laws. The passengers are required to disclose that information prior to flight, and they can and have been banned from flights when it's determined that they have provided false information. Currently today, we don't receive health information regarding individual passengers. The health department does receive that, so this model doesn't change that, whether it's at the airport or it's an off-airport location. The procedure is still the same.
There's one thing that concerns me is that if the county leases premises to a private company, that company does a test for a cost, and that's fine, that's the fee. But then the health department finds out before this person takes a flight that this person is tested positive for COVID. Does our health department have any liability or, a requirement to notify the airport or to notify the flight company? I'm just a little concerned on the legal part of this, and I don't know if Denise Marie, if this is something that we should look into, since the county is getting a benefit from leasing our premises, and our health department is getting the information, and this could actually affect everybody on that flight. Are we opening ourselves up to any liability for not notifying the flight, the people at the airlines, that somebody is coming on who is contagious?
So we're not able to get that information.
Let me I referred this to Denise Marie if I could.
Based on what Laura was just going to say, we are not privy to that information, so our exposure is minimal. But we are very sensitive because we're all treading in new waters on a lot of these different things and how to handle this and how to protect people and balance it with the law. So we'll continue to watch how it works and make sure that we flag those issues and deal with them as they come up. But the exposure to the county, I don't want to ever say it's non-existent because we know, and
Right.
anyone can sue on anything, but
Right.
it's not raising red flags for us not to go
Well, I think it's a great idea. I think it's a great idea, and I like the idea that people can even walk in. So it's almost like we've created another site for testing, and it's pre-security. Just a little rings a bell about liability in terms of people getting off a flight and then finding out, well, the person I sat next to was tested positive for COVID. The Department of Health knew about it, and nobody told me, and now the entire flight has to be tested. So I'm just a little concerned about that, that's all. But I think it's a great idea.
And just to clarify, for the testing, it's by appointment only. It's
by what? It's by-
appointment only pursuant to our agreement. However, they're providing other services that are walk-in services, which is non-emergency medical care, not related to COVID testing. So they would be required to do an appointment, and it's to facilitate state travel requirements and for just safe travel to meet the CDC requirements. It's not because the goal isn't to encourage people who we believe that have COVID to come to the airport, it's to facilitate their travel. If somebody believes that they have COVID, they shouldn't be considering flying at all. We've made that very clear that if you are sick, stay home.
But if somebody wanted to make an appointment to get a COVID testing, they could make that appointment and go to the airport to do it.
And they can.
No, let's be clear on this. It's about to explode. We are not, and if we are, we need to pull this item, but we are not having people who are not traveling, who have travel needs, to go to the airport and be tested. They must have travel needs in order to utilize this facility. It is not open to the general public
it is not.
to go in there.
Is it behind the TSA screened area?
It is pre-security.
Yeah,
It is pre-security.
It's pre-security, but let's be extremely clear.
They must have travel.
No one should be going into
Absolutely.
the airport for this purpose if they are not flying. If their intent is not to purchase a ticket or already have a ticket to fly, or they're coming in through arrival, those are the only people should be using this. The public should not be going, the general public should not be going into the airport to use it for a testing
Can we
site.
require travel documents, or is that something?
It is
that
required,
equal?
it is required by the
There you go.
agreement. It is already included in the agreement.
Vice Mayor? Oh, wait, I'm sorry. Commissioner Sacks? Vice Mayor is recognized to respond to this point, and then you'll be recognized again.
And I'm cutting ahead of Commissioner McKinley, and I apologize. We seem to be circling around this issue. We're making this available, but we're not using the information. Can't we have them sign a waiver at the time that they're asking for this test so that we can communicate that information to the carrier and let them know that we have a positive test? I mean, why go through all of this? I understand no one's going to go there except they have a ticket in the hand. So they're going to show their ticket. We know they're going on American Airlines. We know they're going on JetBlue or whatever. We know that they've tested positive, and we're keeping that information to ourselves. There's something wrong with that. I understand HIPAA, but can't we, as a condition to offering this service, have them give us the permission to then disclose to their carrier they have tested positive? Why are we circling around this issue?
If that is going to be our intent, then I am going to recommend to this board, we not do this. We should not be in the middle of HIPAA, people taking tests and the information coming back, and it then comes to the county. I would strongly recommend we not do it. I'm not an attorney.
Then why are we doing it?
Well, number one, we're doing it because the airlines sometimes require people, if they're going to fly, to have a document that shows that they've tested negative. That was just a convenience purpose. But the health department is notified, and I don't know if the person has already taken off before the health department gets their information. I don't know that. I'm not privy to that information. But I do not believe we, as the county, should be put in the middle of this at all. The airlines have a contractual, if I understand this correctly, relationship with the person purchasing the ticket, and they are required not to get on a plane if they're sick or they have displayed any of those symptoms, et cetera. So when you purchase that ticket,
and I understand
that's the
your
case.
concern, not wanting to get in the middle of this, but I'm not saying that we're going to incur liability. At some point, I'm sure, either federally or state, they're going to absolve everybody of liability with respect to COVID. But there's something wrong with this picture. We are holding ourselves out as an opportunity to test passengers, not the general public. We're going to test the passengers, but we're not going to take the next step if there was a positive test of communicating that. And I have a real problem with that. I would prefer we not get involved with this at all if we're just going to give this test and then we're just going to ignore the results. I think that I'm with you, Madam Administrator. If we can't do something with this, and you are uncomfortable with even the idea of us now becoming a conduit of that information, then I'm not sure that this is something we should get involved with. Over $27,000 in rent. It may be something that is a nice to have, but I don't see where it's doing anything for airline safety or passenger safety, and ultimately we're relying upon a passenger to do the right thing, and we know that's not going to happen. We saw that with the passenger from JetBlue who came down here fully infected and infected people who were sitting around him. So let's not assume everybody's going to do the right thing. So I'm having real problems with this. Thank you, Mayor.
Thank you, Vice Mayor. Commissioner McKinley.
Thanks. I don't see this as any different than somebody who went to Ballpark of the Palm Beaches prior to and then finding out very quietly that they have a positive test, putting their mask on and getting on the plane anyway. I mean, there are people out there that are going to behave selfishly no matter where they get tested. I see this as somebody, you know, in my situation, for example, I'd love to go see family in the Northeast. I currently have antibodies, so I know that I'm going to test negative. And if I were to fly in the next 2 weeks, I should still be negative. When I land at that airport in Boston at Logan, I have to show a negative test within 72 hours. This would allow me to go into the airport a little bit ahead of my arrival. I assume I scan something when I get there to get that very quick appointment. I can walk in, I can get that rapid test, and by the time I land in Logan, I either have the PCR results or before I take off, I have the rapid. If it does come back positive, then I'm going to be a responsible citizen. I'm going to tell somebody so I can get my luggage back, and I'm going to utilize the airline's, you know, very lenient cancellation policy and not fly. But I think this is a good thing. Our tourism industry is getting slaughtered right now. This, I think, will help people. One of the reasons people just don't feel safe traveling, this provides some sort of layer of feeling safe, and they still have to wear your mask. You should still wash your hands. Hopefully the airlines will continue not filling middle seats, but I actually support this. My only concern, though, is your hours of operation. A lot of people fly on Saturday and Sunday, and you're not operating on Saturday and Sunday.
That's very easy for us to respond to. It's a matter of minutes. We have over 100 employees throughout our clinics. We have brick and mortar locations. It's easy for us to staff that. We just kind of base that off the original model in RFQ. So we since learned that like Thursdays and Sundays are probably going to be a necessity based on the busiest travel days. So we've immediately already made adjustments to accommodate that. So it's very easy for us to turn that on when we need to turn that on. We have plenty of resources to be able to do that.
Okay. And I mean, I do share your concerns about that one selfish person, but I feel that can happen if they got tested at our South County Admin Center, if they got tested at Ballpark of the Palm Beaches. Those are all county facilities that we are facilitating that testing ability. This really is no different, and I think it's a good thing for passengers, so I support this.
Commissioner Sacks, you're recognized.
Thank you. I just want to finish up some of what I was saying. And looking at the staff recommended motion to approve, it states that there are other airports that are doing the same thing. One is at Tampa International Airport, Fort Lauderdale International Airport. And I'm wondering if we could hear from any of them in terms of the liability going for this county to lease space to a facility or to any commercial enterprise and not really standing by the results of that testing. That is, again, that's a liability issue that concerns me. And if I were on a plane and I later had knowledge that somebody sitting next to me or a member of my family had tested positive, and the county knew it before the passenger went on the plane and infected all of us, especially anybody on that airplane, I think I would contact an attorney. I just feel a little uncomfortable with that. And I'm wondering what the other airports did as a result of the same situation of leasing space in a county airport to a private entity. This is not like the state or the county is doing the testing. We are making money from a private entity doing the testing. Do you have an answer to that? Do we know how the other airports have handled the same situation?
The model is very similar at the other airports. It's actually been a very popular passenger convenience. In terms of liability, we will not know the test results. We cannot know the test results because of federal laws that prohibit us from having healthcare information. The only reason we're offering it is like Commissioner McKinley has indicated, is a passenger convenience because people are requesting it for whatever reason. It can be that they're traveling to the Northeast and the Northeast says, if you want to travel to New York, you can reduce your quarantine period by bringing in a test result. So we do have passengers frequently calling just for that passenger convenience. And in terms of liability, I'll have to defer to the county attorney's office, but I'm not sure how it's any different than some of the other county.
Well, the difference, excuse me, the difference is that we are making money from this. This is a commercial enterprise. This is $1.25 to get tested at the airport an hour before, or 2 hours before you take a flight. And our health department will know the answer. So there's a big difference between, and I don't mean to get serious with you, but because, but you know, you're head of the airports, and I'm just wondering, what does Broward County, what do other counties do, leasing, making money off a test, finding out from a government agency that somebody's infectious, and then not having the obligation to notify a private carrier that that person's going to infect everybody on the plane. I just need to know an answer to that legally before I can approve of this.
I don't know what any other counties are doing. I can tell you that within our lease agreement, it has a provision regarding indemnification. So in the event that the county gets sued due to their acts or omissions, then they will indemnify the county and against any claims, and that's due to their acts or omissions under the agreement.
So before I can make a decision on this, I would have to see a copy of that agreement with the private company before I can honestly say that this is something that I would approve for the public. But I appreciate your honest answer. Thank you. Thank you very much.
Commissioner Bernard, you recognize, sir.
Thank you, Mr. Mayor. It seems like we have some issues and some concerns regarding this item. My recommendation is that we should table this item and then bring it back. And so my motion is for us to table this.
A motion by Commissioner Bernard to table agenda item 6D2. Is there a second? Second by Commissioner Sacks. I'm going to go into public comment. Eric Polanco. Do you want to go before public comment, Commissioner McKinley?
Yeah, I do, and the reason...
Recognize, ma'am.
Thank you. Ms. Baker, when is our next meeting?
I believe it's March 9th.
Our next regular meeting is March 9th.
Okay. You know, we've got a holiday weekend coming up in that. We've got spring break starting on that. I don't support a motion to table. I think this needs to be approved today. So I would offer a substitute motion to approve item, what is this one, 6D2.
So a substitute motion offered by Commissioner McKinley on agenda item 6D2 to move that forward for passage. Is there a second? Seconded by Commissioner Weiss. We'll move now to public comment with Mr. Eric Polanco. You'll have 3 minutes, sir.
I have a zoning meeting.
Good afternoon, Commission. Thank you for the opportunity to speak. My name is Eric Polanco. I'm a partner with Resource Group of North America, also known as Dr. Tom Dorita. And our client, Ellipse Diagnostics, was actually one of the companies in competition on the RFP. We tied for first place, lost on a technicality. And I'm here today to voice our support for Helix and for this, right? We have an unpredictable future in terms of the pandemic right now. And with testing requirements on international travel, as well as potentially on domestic travel, we think it's important for Palm Beach International Airport, as well as the County Commission, to support an on-site medical testing center. And Helix is, as has been said already, is not only going to be supporting and offering medical testing services, they're going to be operating a minor emergent care clinic as well. And with over 30 years of experience, we do support Helix in this agreement with the airport. Thank you.
Thank you. Can you assure me that the other airports that do this don't have indemnification agreements with the government to indemnify them should there be legal liability?
Yeah, Mr. Mayor, I appreciate the question, but I cannot.
Okay. All right. Well, that concludes public comment. And with that admission, I have to join my colleague, Commissioner Bernard, in voting against the substitute motion. Is there further comment by members of the public or by members of the board? The pending motion made by Commissioner McKinley is to move forward on 6D2. All in favor? All opposed? All right, the motion passes 4-3. The substitute motion passes on 6D2, and the item has been approved. Thank you for your time.
Thank you.
That concludes airports, an exciting day for airports.
Hopefully not as exciting next time.
But a job well done. Thank you for
Thank you.
everything, Ms. Beebe. All right, we're back on the regular agenda, 6A1, Housing and Economic Sustainability. This is in District 7, related to funding increase for New Urban Community Development Corporation.
Mr. Mayor, if no one needs a presentation, I'd like to make a motion to approve item
6A1.
A1, A, B, and C.
Motion made by Commissioner Bernard, seconded by Vice Mayor Weinroth. There's no public comment. All in favor, all opposed. 6A1, A, B, and C passes 7-0. 6B1, Facilities and Development, quitclaim deed in favor of Judith A. Hoover. Requires a supermajority vote. In District 5, would you appreciate a presentation on this, Commissioner Sachs?
Oh, District 2.
Oh, I'm sorry. I was looking at supermajority 5. District 2, Commissioner Weiss. Is there a motion?
Move to approve.
Yes, I'd like to move 6B1, A and B.
Second.
Motion made by Commissioner Weiss and seconded by Vice Mayor Weinroth on 6B1, A and B. Requires a supermajority vote. All in favor, all opposed. That agenda item and conveyance passes 7-0. 6B2.
Mr. Mayor?
Sir?
As much as I hate to do this, because I hate this agenda item, I don't want to spend another moment on it, so I'm going to move forward to approve 6B, 2A and B, specifically to identify B, which gives the county administrator or designee the ability to put this to bed if this does not finally get done with this extension.
Is this just emphasis added on B?
Emphasis on B.
Okay. Bring you back to law school. Emphasis added. All right, 6B2, A and B. Any comments by members of the board? Any comments by members of the public? I don't see any cards. And with a hefty amount of delegation of authority to the county administrator, 6B2, all in favor?
We need a second.
Is there a second? All right, Vice Mayor Weinroth has moved 6B2, A and B, seconded by Commissioner McKinley. All in favor? All opposed? That item passes 7-0. Good luck to you, Mrs. Baker. 6C1, that's very good. So we'll get up here, and this is regarding a resolution of the Board of County Commissioners supporting the state of Florida's activity to monitor, analyze, and protect the quality of water.
Mr. Mayor, I'll go ahead and move approval of item 6C1.
61 has been moved by Commissioner McKinley, seconded by Commissioner Marino. There's no public comment or comments by members of the board. All in favor, all opposed. 61 passes 7-0. 61 has passed previously. 62 has passed previously. 6E1, administration.
This was the one I brought forward.
Okay, and this is relating to resolution regarding
Regional
Planning Council, brought forth at the suggestion and direction of Vice Mayor Weinroth. Mr. Bonlarin, you're recognized.
Thank you, Mayor Kerner, Vice Mayor, members of the board. At the January 26th BCC workshop meeting, staff was directed by the commission to draft a resolution that would oppose Senate Bill 62 currently filed in the Florida legislature. Additionally, the direction was to bring back a presentation on regional planning councils to kind of walk you through where we are today, where regional planning councils have evolved from, what the authority and functions of those councils were, and maybe potentially have a further discussion on that. So Patrick and I are going to run you through a very brief PowerPoint presentation. You'll see on the first page we have the 10 RPCs that exist in the state of Florida, ours being the Green, Indian River, St. Lucie, Martin, Palm Beach, the Treasure Coast, in South Florida. The next slide, we've just got a brief history of where we've come. So in the 60s and 70s, RPCs were first formed in Florida. They authorized 2 or more of the counties or municipalities to create an RPC to resolve issues that transcended those initial boundaries. So they were there to help keep some of the peace and broker some of those deals. Tampa Bay was the first, and our Treasure Coast was established in 1976. When DRIs, developments of regional impact, were implemented in the early 70s, RPCs became charged as the agency to review those DRIs. Very significant function. Then we fast forward to 2011, where we saw some of the first pieces in the Florida legislature pushing back on some of the RPCs. General revenue and state funding to RPCs was vetoed by the governor and ultimately led to that line item being removed from the budget. Even though our RPC receives some state money today, most of that is through grants that they get on behalf of the state, but not a dedicated line. In 2012, there was some additional authorization for RPCs to provide some consulting services, which they do today and generate a portion of their revenue from today. 2016 was a big year for RPCs. That's when this board, previous board, began the discussion about our participation in RPCs, Treasure Coast. There was talk about moving to South Florida, but we followed this bill and worked closely with the legislature, and ultimately what it did is it dissolved and reapportioned one of the RPCs in the state of Florida, and it eliminated certain roles of RPCs that we've delineated for you here. The development plans for rural land stewardship were reduced. The review of DRIs was eliminated. The siting of electrical power plants and the review of urban transportation plans within the MPOs. So we saw significant legislation that changed the role of RPCs more in an advisory capacity, which they serve in today. And then what we're seeing today in 2021, if adopted, RPCs under the current legislation would be completely removed from reference in Florida law. They would allow to exist, but not under state law. They would no longer be governed under state law, but through interlocals that might exist locally. Those functions of the RPCs today would be reassigned, so local governments would take on some of those responsibilities, and the water management districts would maybe take on other responsibilities that they have in other areas of the state, and then it would expressly allow local governments to continue some of these arrangements if we chose to do so at the local level. In the next slide, we talk a little bit about just our general participation here. 1973 was when the state was divided into the 4 regions, and we were in a group with Dade, Broward, Monroe, Martin, St. Lucie. And then in 1975, they were divided again. Palm Beach was put in with Martin and St. Lucie, and ultimately Treasure Coast was established in 1976 to establish Indian River County. The next slide, please.
So transitioning to what RPCs do and the responsibilities are set forth in statute. Actually, there are a number of references to them throughout. Primary references in Section 186 identifies as functions acting in advisory capacity to local governments, regional, metropolitan, county, municipal planning matters. So they cross many boundaries there, providing technical assistance in growth management matters, conducting studies, preparing and adopting a strategic Regional Policy Plan, which touches on things such as housing, economic development, emergency preparedness. Also reviewing plans, independent transportation authorities, MPOs, other transportation agencies. Moving on, next slide, then that kind of touches on the primary. Moving into other areas they participate in, assisting in review of developments of regional impact, be it in the pre-app conference type meetings, pre-application meetings, working with folks along the way throughout that, participating in the strategic intermodal system plan, working with other development patterns. There's a statutory designation called a Florida Quality Development, and then areas of critical state concern. So it touches on it broadly, but there are a number of areas that regional planning councils are able to participate. And then they perform and represent in state committees, programs, et cetera, providing their knowledge and assistance in those areas. So on to the next slide. Another function that that certainly Treasure Coast provides is as almost a consultant, a resource to many local governments to perform planning studies, and I use that term broadly. They've done a variety of studies, done it for the county and many other areas. So just touching on a few, our urban redevelopment area, that goes back about 10, 12 years or so, assisted us in a major study, Indian Trail Improvement District Corridors Plan, number of TOD, transportation-oriented development type studies, working with CRAs on master plans, working with cities and downtowns, things of that sort. So I think at any given time, just looking through the most recent information, they're active, certainly in Palm Beach County, probably 4, 5, 6 different studies at a point. Then moving on to the next slide, we'll talk about membership really quickly. And again, statute sets forth the memberships, not more than less than two-thirds of the reps are elected officials from local governments chosen by the cities and counties. Remaining are gubernatorial appointees. So taking a look at on the Planning Council right now, 28 total members, 19 locally elected, 9 are county officials, 10 are municipal officials. There are 9 gubernatorial appointees on the Planning Council, 4 ex officio officers as well. So I think Todd might have mentioned it earlier, just to be clear, our representation for Treasure Coast Regional Planning Council represents Indian River, St. Lucie, Martin, and Palm Beach counties.
Is the governor still appointing to our RPCs? Okay.
Yes. And then the next slide, last but not least in the part related to membership, is it identifies some of those ex officio positions, and Treasure Coast does identify the ex officio members who are designated to serve as well. So
your final slide that we have in the presentation for you is just about some of Senate Bill 62's implication, and actually would be remiss if I didn't point out Tom Lenahan, the Executive Director of Treasure Coast Regional Planning Council, is here with us today, and certainly might have some other comments and be here to answer some technical questions that the board might have. But just on this bill, we talked through the history of where RPCs were, some of the bigger functions of them, particularly in the area of DRI review. And that elimination has you've seen sort of a chipping away and erosion of some of the authority that RPCs have had. This would do the same. It would look to remove all references in Florida law of RPCs. Again, we would no longer govern these by the state of Florida law, and they would be done by interlocal. The functions would be reassigned. And then that RPC, currently as it is today, just serves an administrative advisory role. It doesn't preempt the local government authority for land use that exists today, would not have regulatory powers, and it would continue to allow local governments to enter into agreements on regional planning entities. We share some of this background with you today just to kind of give you a little bit idea of where RPCs were, where they are today, and an overview of the legislation. What's pending before you today is only a resolution on whether you would like to oppose Senate Bill 62, but we wanted to provide this background at your request in case you wanted to engage in any other conversations or provide additional direction to staff regarding this particular issue. And with that, that concludes our presentation, Mayor.
Vice Mayor Weinroth, you're recognized.
Thank you, and I thank staff for this very thorough analysis of the of the rationale behind RPCs and their value. I think it's important to, again, stress that the problems that we face as a board are generally not just problems that respect political boundaries, that many of the issues that we addressed, whether it's transportation, whether it's housing, economic development, emergency preparedness, these are regional issues. And the more opportunity we have to work with one another beyond our county, you know, it's the reason why we have FAC. You know, the county has 67, or the state has 67 counties. We're all different, but we all get to hear what's going on in other sections of the state, because we know that these are ways that we figure out solutions to the problems that are here for our stakeholders. I think it's short-sighted for us to be just summarily putting the regional planning councils out of their misery. I don't think that there's a reason to do that. I think that the way that this has been configured with 19 municipalities, 9 members of counties, 9 gubernatorial appointees gives us a very broad range of opinions, a broad range of perspectives, and I think that this is a vehicle that needs to be maintained. And so I would be very much in favor of a resolution from this body being sent to Tallahassee, affirming our desire to see Senate Bill 62 defeated. Thank you, Mr. Mayor.
Is that your motion, sir?
That's my motion.
61 has been moved forward by Vice Mayor Weinroth. Commissioner McKinney, you're recognized.
I'll second the motion for purposes of discussion, but I just want to let you know that the Association of Counties has not taken an official position on this issue. They are currently weighing the pros and cons of this legislation. To my knowledge, this is the only regional planning council that is going through consideration of a resolution in opposition to this bill. I just don't think we know enough yet about its implications. They're certainly not eliminating our ability to continue having a regional planning council. It would just be up to us to keep it going. So I'll go ahead and support. I would assume staff will then bring back to us a formal resolution.
That's before you today.
Oh.
So attached to the agenda item, that is what this agenda item is, Commissioner. This is the resolution that would oppose and urge the legislature not to pass Senate Bill 62.
Okay, my
In its current
apologies.
form.
I didn't bring the whole book down. I just brought the abbreviated version. I'll go ahead and keep my second of the motion for purposes of discussion, but given my role with FAC and the fact that we haven't taken an official position on it yet, I don't want to get myself in the crosshairs of the organization I'm currently leading. So I can't support this resolution. Thanks.
But did that include a second of the motion?
I did second the motion, but I'm not going to support.
Very good. Commissioner Bernard, you're recognized.
Thank you very much, Mr. Mayor. I'm not going to be able to support this motion. I think that this item is, you know, in Tallahassee, and I saw that it had a vote on the 26th of January by the Community Affairs in the Senate. There's no House companion bill so far, and so I don't think that we should weigh in on this bill right now. You know, we should let the process play itself out in Tallahassee. Thank you.
Got our legislators getting involved, because I'm concerned what happens when this bill turns into something else and then we're on record supporting it. We may want to think about that. If it's just RPCs you're focused on, we may want to just do resolution supporting RPCs, and because this bill could be gutted. Anyways, Commissioner Sachs.
That's actually an excellent idea, Mayor. I have, what saith the legislative delegation? What are our senators and representatives supporting the bill or not? What do they say?
So Mayor and Commissioner Sachs, we've not done any kind of formal polling or conversations with our delegation members, but what I can tell you is Commissioner Bernard rightly pointed out that piece of legislation passed community affairs by a vote of 6-3. Two of our senators serve on that committee, Senators Polsky and Powell, who voted against the legislation in its current form. So that's the only indication that we've got to this point of where our delegation members might individually stand on the bill.
So our two senators would support keeping our councils here.
Indicative of that vote that they had would have been that they were opposed to the bill as it's been filed.
And this is really an issue of, like, home rule. Should we have Tallahassee tell counties they should not have regional planning councils? It's my understanding, and correct me if I'm wrong, Tallahassee does not give us any money for these councils. Is that correct?
So they don't provide a specific line item for those funds and support the operations. However, there are limited state dollars that the RPCs compete for different grants that they receive, and the Treasure Coast, I think, gets a little over $100,000 in revenue from the state from some of those grants that are provided to them.
But there's nothing in the budget, in the state budget, that would provide money for regional councils. Number two, our regional councils are supported by the county. Palm Beach County gives money for the councils, as well as, I would imagine, in the Treasure Coast, the other counties as well. I agree with the Vice Mayor that our work does not end at the county line, and I support the idea of having regional councils, number one. Number two, I do not support Tallahassee telling us that we can't have regional councils, especially since there's no money in their budget for it. Number three, every year I was in Tallahassee in the legislature, this issue came up, and it was always shot down. So I really support home rule, and I think that if counties want to come together and congregate and learn from each other and put their ideas together on how to best support the people in their counties, I think that, darn it, we should do it. And especially since we pay for it, it's our responsibility to do it. So I would certainly support the idea of the regional councils, going along with what you said, Mayor, in terms, and Commissioner Bernard, in not necessarily naming the Senate bill number, because it could be a train. Never know. Could take away our airport or something. You know?
A bill relating to transportation. Could be
Right,
anything.
exactly. You never know. But I would certainly, I would certainly support a resolution from this county saying we support county regional councils, and I certainly would do that. Thank you for bringing this up.
Very good. Thank you, Commissioner Sacks. Commissioner McKinley, do you need to respond to that point, or can I recognize?
I just want to respond. I just want to clarify, my opposition to this resolution today is not indicative of my support for regional planning councils. The association is yet to make an official position or take an official position on this. Until they do that, I don't want to go on the record of supporting or opposing the bill. But it's certainly not a statement about my support for regional planning councils and the work that they do. But to Commissioner Sacks' point, I'm looking here at the statutory references, and this probably has, it looks like 50 at least, if not more. Just that you could tack on to make it germane the last week of session. So it could very well turn into a train bill. But it's also important to note that it does not have a House companion at this time.
All right, Commissioner Marino, you're recognized.
I'm going to get into the weeds a little bit. I understand the importance of what we're doing here today and how we are trying to protect home rule and going forward with our legislative agenda. So this is where I'm going into the weeds a little bit. There are a lot of other things right now that are, I actually think are more important than this, which it would include a vacation rental bill, the local occupational licensing bill, and also the municipal code enforcement bill that wants to make it illegal to have an anonymous complaint. So there are a lot of mandates and preemptions that are out there right now that also need our attention. So while I'm commenting not necessarily on regional planning councils, I am commenting on our legislative agenda. So that was more of a comment than a support or a lack of. Thank you.
Very good, and well taken points, and thank you, Commissioner McKinley, for clarifying your position on this. I'm sure RPCs are great organizations, and I do want to invite, if you wish to speak, Mr. Lanahan up, but only because of the reference to the bill number, I can't support the present motion, unfortunately. You'd be surprised what you co-sponsor in the legislature by the time it works its way to the House floor. There's all kinds of crazy stuff in there. And so we need to take a cautious approach on attaching our name to a bill number. Mr. Lanahan, did you want to speak?
Sure. Thank you very much. And I certainly appreciate that sage advice from folks who have spent a lot of time up there in Tallahassee and the different things that can happen with that process. So I think certainly if you all would like to reform the resolution to be more of a general expression of support, or something along the lines of keep them like they are in the statutes, I think that would be fine. I understand the issue with the specific reference. And just kind of briefly, your staff did a fine job presenting about what the Regional Planning Council does. It is your Regional Planning Council. We are while we're authorized in statute, we operate based on what the members of the council want us to work on. So each of the regional councils does some slightly different things, and that's because that's what's important in their particular region. We do a lot of work on intergovernmental coordination. We bring local perspective on state issues. We bring counties, cities, the private sector, FDOT, FDEP, DEO together. And one of the things that we bring to the table in those engagements is we are a neutral party. And we are often brought in to help a couple of jurisdictions come together on an issue, find common ground, and that's something that we frankly enjoy doing. We are involved in economic development activity. You all participate in a revolving loan fund for economic development and also coronavirus response by virtue of the existence of regional planning councils. We pursue EDA, Economic Development Administration funded projects. For example, here in Palm Beach County, Boutwell Road was partially funded through EDA. We work on CRA plan updates currently in Palm Beach County, and my remarks are focused on Palm Beach County because that's where I'm standing here today, but understand we do these sort of things across the region. But CRA plan updates, we're working with Riviera Beach and Delray Beach on updating their existing CRA plans. I think there has been here in these chambers, many discussions about the relative merits of CRAs. However, I think everyone would agree once they're established, it's certainly important that their plans be as effective and efficient and up to date as possible, and that's something that we help local jurisdictions do. Regarding planning, we do still look at comprehensive plan amendments. While we have no authority or thumb up, thumb down on those, we provide a lot of information and advice for those. We bring that information from one jurisdiction to another across the county and across the region, and try and find best practices and reduce conflicts in those things. We've been very involved with station area development along the Tri-Rail corridor, both planning for new service, optimizing their assets at their existing locations, and those sorts of things, improving ridership, helping maybe them find some more funding for their operations based on utilizing their land. We also helped with the Glades area master plan that was done a few years ago. Spent a lot of time out there in those communities working on that. Active in redevelopment, urban redevelopment area, as Pat mentioned, thank you. Boynton Beach Town Center Plan, North Palm Beach, Lake Park branding and market strategy. we worked on with them. And then the field of housing, participating, where and when we can, raising those issues of importance, and looking at the way the different pieces work together. Land use, transportation, economics, those things are all interrelated on affordability of housing. Transportation, we work on complete streets and quiet zones. We've done a lot of quiet zone work here in the county. Emergency programs, disaster training exercises. We did one a couple of years ago out in the Glades area. Hazardous materials training for first responders, and mitigation and resiliency planning. Last, a new area of business, as everyone's had to get into, coronavirus response. We've provided support for the Business Development Board on their business response website, and also are conducting an impact survey across the whole region to gain data that'll help us recraft our economy in whatever state this new world is going to be. And so I do ask that you support your regional planning council and oppose the proposed changes to the statute. And I don't think there's any pending questions, but I'm happy to answer anything that would come up in further discussion. Thank you.
Thank you very much. Don't go too far. And that was a great presentation or comments, except that we don't even say the word CRA in this chamber at this point. We don't even mention it. We don't think about it. We don't do none of that. All right.
Knew that was risky, but I figured I better say it.
RPCs, I think we're all right with. CRAs, I don't know. Commissioner Weiss and then Commissioner Marino.
Thank you, Mayor. I'd like to make a substitute motion that we table this item and direct staff to remove the references specifically to SB 62 and rewrite the resolution as a support for RPCs.
It's a substitute motion made by Commissioner Weiss, seconded by
I'll
Commissioner
second.
Sacks. We'll go-
If I,
Sorry, did you second the motion?
I was just wondering if we could do it right now. So because they're going up to Tallahassee soon.
Well,
I don't know.
Commissioner
I was just-
Weiss's motion contemplates bringing it back. Is that correct? Is there? So let's just get the motion on the table made by Commissioner Weiss. Is there a second? Is there a second? Commissioner McKinley.
Commissioner Weiss, so what you're saying is we just simply pass a resolution today that we support regional planning councils?
Today?
If we can do it today, I would second that.
Todd, this is like doing an amendment in
On the fly.
Yeah.
right? Where you handwrite
the
it?
time.
Can we accomplish that today?
Can we do that?
Yeah, I think that the whereas clauses that we've provided to you are fairly general and broad in terms of what RPCs do. We can remove one or two of those and maybe add an additional one and then strike in section 1, just rewrite it that, Palm Beach County has resolved that we support regional planning councils in the state of Florida, period, if that's what the motion maker is looking to do in this.
Is that what the substitute motion maker is looking to do?
Yes, sir.
Second.
There's second by Commissioner Sacks. Commissioner Marino, you're recognized.
Now, I was going to make the same motion that we just do the editing now and get it done with.
And that's what's on the table in the
Yep.
substitute motion.
Absolutely.
So we'll just remove the reference in the last whereas clause to Senate Bill 62. And then in section 1 of the now therefore be it resolved, we'll just say that Palm Beach County, that the Board of County Commissioners supports regional planning councils in the state of Florida, period. And we can draft it as such, if that's kind of when I got back.
Vice Mayor Wanroth, you recognize, sir.
Yeah, I certainly would support that substitute motion, and I appreciate the work that this body is doing to turn this around and address our concern about RPCs without specifically focusing on SB 62.
Very well said, and we appreciate you bringing this issue forward, Vice Mayor Weinroth. That concludes comments by the public, comments by the board. The motion has been made, the substitute motion by Commissioner Weiss, seconded by Commissioner Sacks, in support of RPCs. All in favor? All opposed? Any opposed, just to be clear? Very good. The motion passes 7-0. Thank you very much for everyone's participation. That concludes the
Thank you.
regular agenda. 7A1, board appointments.
Can I make a motion to approve 7A1 with the exception of the real estate professional seat? Because
good.
in speaking with staff, I asked for a clarification of what qualifies for a real estate professional
All right, so we'll bring the real estate professional appointment back.
at a later date.
Very good. So the motion's been made by Commissioner Marino on 7A1 to move those appointments forward except for the real estate professional position. We'll bring that back. Is there a second? Seconded by Vice Mayor Weinroth. There's no public comment or further comments by the board. All in favor? All opposed? 7A1 passes 7-0. We're now on to 7B, Commission District Appointments. We'll start to my right with Commissioner McKinley. None? Commissioner Marino.
Yes, I would like to appoint Douglas Sanders to the Aviation and Airports Advisory Board.
Oh, we could have used Douglas today.
And he's,
He doesn't even know what's coming.
he doesn't know what's coming.
We have a motion by Commissioner Marino, seconded by Vice Mayor Weinroth. All in favor, all opposed, that passes 7-0. Any further appointments? Vice Mayor, you're recognized for Commission District appointments.
I have none, thank you.
Commissioner Sacks, do you have any Commission District appointments? Commissioner Weiss?
None, sir.
None, Mr. Mayor.
Bernard? I have none. We'll move now to staff comments. 8A, administration comments. You recognize Ms. Baker.
At our last board meeting, the board directed staff to look at alternative accommodations for people that were, that claim exemption to our mask order. Staff has identified a location across the courtyard under the garage. There's some office space there where we used to have offices. So we'll set up the same configuration that we have out in the lobby, where you have the podium, you have a camera that people can see you in here and we can see them on that side. So if there is no objection, or if this board will give me direction, support to move forward with this, we would start to move forward and have it in effect for our March 9th meeting.
Very good. It looks like we would refer this to you to utilize your executive authority to institute this. Very good. Any other comments?
No.
We'll just go on to 8B then, County Attorney.
No comments, thank you.
All right, and then we'll move to my colleagues on the Board of County Commissioners. We'll start with Commission District 1, Commissioner Maria Marino.
Okay, then. This has been a long meeting, so I'll keep my comments short. I just want to say that last month we approved a proclamation to the Edna W. Renner Tutorial Center, which I gave to them over the weekend, celebrating 35 years. And if you ever want to see an organization that is more than just a tutorial center, it's really the West Jupiter Community Group, and they do more than just tutor kids. They console parents when a child has lost their life to a drug overdose. They take care of kids who are wearing the same clothes for 2 weeks in a row, so a teacher calls them and says, I don't think this family has a home. There are so many things that this center does other than just teach kids. It really tries to keep the families whole. And most often, a lot of these kids, it's not a parent, it's a grandparent or an uncle or an aunt. So I know you've heard me talk about this center before. I do have closeness in my heart for them, and I would encourage any of our commissioners who have not been to the center or have not met Edna, please let me know, and I'm happy to arrange a meeting with you and with her, because Verdina, you've met her. She's a dynamo. She is just, she's a force of nature, and we need more of her, and we need more of the good work that she does. Thank you.
Very well said, Commissioner Marino. Thank you for those comments. Anything further? Nope. Commission District 2, Commissioner Weiss.
Thank you, Mayor. Just briefly, I just want to thank not only our staff, but the staff of the Health Department, the Healthcare District, and our state strike teams that came in and have done a phenomenal job, I think, in really getting us, getting our people vaccinated, reaching out to hard-to-reach communities, ensuring that they also have equitable access to the vaccine, and I had the opportunity on Friday to see Commissioner Bernard's work firsthand in helping to set up and organize those venues, and really appreciate his work as well. And just wanted to thank everybody for their assistance in making this happen for our constituents.
Thank you, Commissioner Weiss, for your comments. We're going to move now to Commissioner Sachs, District 5, for comments.
Thank you so much. I think that having seen Commissioner McKinley out at Pahokee and working with the people there, and how well the rollout of the vaccine went, just started my week out beautifully. And as I said before, she's really a representative of her district, but I see that with every one of us, you know. Also, Commissioner Marino, the way you care about the people in your district. I've been to Publix's up in your district, and everything is so well organized, and they should know, the people there, how well you serve them. And I know, Commissioner Weinroth, that streaker at the Buccaneers game had to come from your district. I just knew it, you know. But be that as it may, it has been a wonderful week in terms of not just football, but in terms of people getting vaccinations, and the wonderful response that we get from people who compliment, you know, Ms. Baker and all the folks at the healthcare district, the firefighters, the strike force. We're just very pleased. We're not there yet, but we're going in the right direction, and I'm very proud to be part of this group. Thank you, Mayor.
Thank you, Commissioner Sachs, for your comments. We'll move now to District 6, Commissioner McKinley.
Thank you. I want to give a special shout out to the Secretary of the Florida Department of the Lottery, John Davis, who is Pahokee born and bred, as well as Anquan Bolden, for their assistance in helping us draw attention to the need out in the Glades. They certainly helped elevate that request, and I'm very appreciative for their support and the continued work that they do in the Glades community. Mr. Bolden certainly hasn't forgotten where he came from. And also congratulations to county staff for being able to pull off the impossible and getting the transitional housing and the homeless resource centers up and running in Belglade and Pahokee. That facility is absolutely beautiful. I invite you all, when you get a chance, to go out to Pahokee and see what those contractors were able to do. It's phenomenal. I want to congratulate one of our colleagues. If I'm not sure, some of you may have met her, Liz Archuleta, who is a Coconino County, Arizona County Commissioner, who was just appointed as the Intergovernmental Affairs Director to the White House over at USDA. So it's nice to know in an agricultural county like ours that we've got a friend who has a direct access to the leadership at USDA and the White House. I'm very excited for her. And then in closing, Mayor, I want to congratulate the Tampa Bay Buccaneers. I was raised on the west coast of Florida, and so grew up. My parents were from New England, so we actually, born as Patriot fans, moved to Florida, became Bucs fans. So very exciting for many reasons that Tom Brady was able to bring that win home for the Tampa Bay Bucs. But I also want to tell you that I was in Tampa over the weekend at my sister's. We should say a prayer right now for Hillsborough County and the Board of County Commissioners there, and for the mayor and the city council of the city of Tampa. What the commission, what they're facing, and what Mayor Castor is about to face, I fear, is a super spreader event. And despite all of the regulations that were put in place to prevent something like that, I mean, the Super Bowl was coming. They couldn't put the brakes on that one, but it goes to show the very difficult position that local leaders are put in because of the governor's orders. Mayor Castor put in a high traffic area mask order, but we don't have any ability to enforce those. And when everybody is moved out into the street, there's nobody that owns the street. They can't sue the street. They can't fine them. They can only fine business owners. Most of what you saw was outside of those businesses, and the governor has put us local leaders in a very difficult position. I was watching social media last night, and there was just a lot of hate and misinformation pointed at the mayor of Tampa and why she didn't do more. She did everything she could within her power based on the preemptions that she has to operate under. So congratulations to the Tampa Bay Bucks, but let's say a prayer for our colleagues over in Hillsborough County. Thanks.
Thank you for your comments, Commissioner McKinley. Commissioner Bernard.
Thank you, Mr. Mayor. I'd like to request to do an off-site proclamation recognizing the F. Malcolm Cunningham Senior Bar Association in its 20 years of awarding scholarships to law students.
Second. Very good motion by Commissioner Bernard, seconded by Vice Mayor Weinroth on an off-site proclamation. All in favor, all opposed. The item passes 7-0. Further comments?
No further comments, Mr. Mayor.
Very good. Vice Mayor Weinroth, you recognized for comments.
Thank you, Mayor. Commissioner McKinley, while you were in Tampa, I ventured into your district, and Kelly and I enjoyed an evening at the Great Charity Challenge, and it was really a great event. Unfortunately, it was less spectators than usual, but they were able to do it, and it was wonderful. Over $1 million was given away during that event. The YWCA was the grand winner, taking $100,000 home, and there were over 20 charities, I think 27 charities that received checks during that event. So it was really great to see that our community is slowly starting to get back to some form of normalcy. The governor, during our meeting today, has announced that 25,000 doses of the vaccine will be going to Walmart. They will be going to the 119 Walmarts in the state. So again, that will add to what's going on with Publix and what, of course, our healthcare district is doing. So again, there are lots of opportunities for our residents to be getting an appointment to get vaccinated. I remind you, with Publix, they open their portal on Mondays, Wednesdays, and Fridays. They've moved it to 7 a.m. from the previous 6 a.m., so you don't have to get up quite as early. And we are going to meet this challenge, and we're going to get past it. So everybody get vaccinated. It's the way that we're going to get past this pandemic. Thank you, Mr. Mayor.
Very good. Thank you, Vice Mayor Weinroth. And I'll just remind the members of the community and residents that the Board of County Commissioners will be meeting tomorrow as a Solid Waste Authority at 9 a.m., and we are adjourned. Thank you.